Get ready for the session. Take your notes. Keep everything ready. So this is the topic for today. Yes, we are here. So, Sumaira, can you hear me? Sumaira, can you hear me? Smita, can you hear me? Rabjit,
Hello, sir.
yeah, can you hear me?
Yes, sir.
Yes, okay.
Yes, sir, I can hear you.
Yes, okay, that's clear now. So the session commences. So the case notes, copy. First page. And this is the second page. I have posted it in the case notes. You can check it from here. Yeah. Yes. Okay. Now we are going to write the introduction. So we are going to write 5 paragraphs. So the body of the letter. The body of the letter. The introduction. The body paragraph 1. The body paragraph 2. The body paragraph 3. The conclusion. So these are the things that we are going to do now. So the introduction, the body paragraph 1, the body paragraph 2, the body paragraph 3, and the conclusion. So first we are going to see the introduction. So the introduction will have 4 different things. The introduction will have 4 different things. We have already seen all the other things. So we are going to do with the body paragraphs. We'll write 5 paragraphs. 5 paragraphs. Okay. So what are the things that we have to write? Number 1. So who is the patient? This is number 1. Who is the patient? That is number 1. Note down. Make your notes also side by side. I'll give you different variations. Next one is, what does she require? Okay. What is her present status? What does she require? What is the type of letter? What is the type of letter? Okay, who is the patient? What is the type of letter? What is her present status? And what does she require? So, who is the patient? Miss Margaret. Helen Martin. Miss Margaret Helen Martin. Miss Margaret Helen Martin. What is the type of the letter? So you have to know. Now study the case notes and find out what these are. Yes, I have already sent you the case notes. It is in the Telegram channel. This is the link. Copy, post link. I'm sending the link here. So there you can check. So yes, all these things, make notes of this one. I'm going to explain everything. Yes. Right. Now here you are using the information in the case notes, write a letter to the nurse in charge of the district nursing service outlining Miss Martin's situation and anticipated needs following her home tomorrow, her return home tomorrow. So returning home. So it is a discharge letter. So discharge plan, here it is. So it is discharge letter. Right. Discharge letter. So this is a discharge letter. What is her present status? What is her present status? Okay. What is her present status? So the present status, what is her present condition? What happened to her? Try to analyze what happened to her. So where you have to go? This is the diagnosis. She was diagnosed with this one. Okay. She was diagnosed with coronary artery disease and angina. So that is afterwards what happened. Yes, this is very, very important. So this was the problem. Who was diagnosed with coronary artery disease and angina. Relax and learn everything. Okay, this is the final part of this letter. Then treatment was angioplasty. This is a repeat angioplasty. Earlier it was done in 2008 and now it is done again. Repeat. First time it was done in 2008. Fine, discharge date. So you can see here also discharge date. Okay, 16 July 2017. Okay. So this is the discharge date. And you can see here, discharge, return home tomorrow. That means today's date is 15. So you have to write tomorrow she is going to be discharged. So discharge letter. And now discharge letter. Mrs. Margaret Helen Martin, discharge letter. So discharge the next day. So tomorrow, she is being discharged tomorrow. She is scheduled to be discharged tomorrow. Her discharge is scheduled for tomorrow. However you want to write, you can write. Okay. What is her present status? What is her present status? Successful angioplasty. Successful angioplasty. So that is it. So today, 16th July, okay, angioplasty. When should she join? Admission date 15th July. Admission date 15th July. Remember that. Okay. She was admitted on 15th July and she was discharged on 16th July. So that is tomorrow she will be discharged. That means today only. That is 15th July only. Same day. Same day. So tomorrow she is being discharged. Try to understand the point. Admission date 15th July and discharge date 16th July. That means just there she is there for 24 hours. So today she was admitted and on the same day she underwent the angioplasty. Okay. So fine. Angioplasty. Right. So treatment is angioplasty. So discharge the next day and you are writing today itself. How do you know that you are writing today itself? You have to go here. Her return home tomorrow. So these are the points which you have to notice. These are the points which you have to notice and you are supposed to write these things. Right. Remember this. So copy. So what are the points I'm selecting and writing here? So that is it. Her discharge home tomorrow. Her return home tomorrow. Right. So this is a discharge letter. So discharge. The word comes here. What are the things that will come here? Very important. Miss Margaret Helen Martin. Right. Her return home tomorrow. Discharge tomorrow. Okay. So these are the three things. And what else we have to take? Who is the patient? Who is the patient? You'll go here. This is the patient. Copying the words. So that we are taking here as it is. Okay. Fine. Right. Number one. So point number one, who is the patient? Miss Margaret Helen Martin. What is the type of the letter? Number two, it is a discharge letter. Point number three, what is her present status? What is her present status today? So she today has undergone or just underwent. If it is past tense, if it is yesterday, it is underwent. But today and tomorrow, tomorrow is one day. So today, tomorrow, yesterday. Today, tomorrow, yesterday. The division is day. So present tense you are going to use. Present tense. Undergone. Go, went, gone. Undergo, underwent, undergone. If it is yesterday, angioplasty, then you have to say underwent. But today, because you are using the word tomorrow. Tomorrow means a day. So that means tomorrow, then it is today. And previous day is yesterday. Yesterday is past tense. So the key word is tomorrow. What tense you have to use? What tense you have to use? This word helps you. So today is the angioplasty. It's done. Present perfect tense. So you are using has undergone. What is that? Okay. That is the treatment. This is the treatment. Angioplasty. Has undergone angioplasty. There is a capital letter. Remove. Capital letter. Has undergone angioplasty. Okay, these are the words which you have taken from there. For what? So then the question is, for what? Angioplasty for what? Then you will get the words here. Okay, for what? The problem is here, coronary artery disease and angina. So angioplasty for what? You know that. So that is not necessary here. Because what happened is important. For what is not important. That you can write later. Okay, that you can write later. Right. Now, this is, if you want, you can write there also. This is for this one. Keep it that also for. She has undergone angioplasty for coronary artery disease. Okay. And angina. Don't write CAD. So, now this is how you have taken the information. I did not type anything. I have taken everything from there only. Okay. I'm showing you one by one. First one is Miss Margaret Helen Martin. Take this. Take this. So copy. I'm showing you once again everything. This is what it is. Right. We have posted there. So this word is taken from there. What is taken from there also I'm showing you. Yeah. This is green. Green shows that it is taken from the text. Okay. Next one. Here it is. Okay. Her return home tomorrow. After completion. Return home tomorrow. So it is discharge. From discharge plan, you will take that. And she is discharged. She will be discharged tomorrow. This is the word tomorrow. And here it is. That is tomorrow. How you are going to relate. Tomorrow. Right. So we got the word discharge from there. And tomorrow also we got from there only. Yes. Everything will come from the case notes. But how we are molding and joining is very important. They come from different places, different places. You have to set everything properly. Next is angioplasty. This is the treatment. This is what it is. Angioplasty. The next one. For what? for coronary artery disease, number 1, and angina. So these are the two things related here. So that is what it is. So copy text, and the same thing you are placing here. Okay. Put small letter. And then angina. Right. So these are the things which we have taken there. And she is going where? She is going home. She is going home. Yes. So see all the words which are taken from there. Okay. So how are you molding these sentences? And so what is her present status? Is she has undergone angioplasty for coronary artery disease and angina. Fine. What does she require? What does she require? Now see here. She requires what? Okay. She requires, okay. She requires what she requires. Lot of things she requires. She requires regarding diet. And okay, this is regarding diet. This is regarding physiotherapy. And this is others. Okay. She needs monitoring. She needs monitoring. She needs observation. So regular monitoring. You can use that. She needs regular monitoring. And then what else she needs? Anticipated needs should be provided. She should be provided some things. Okay. So that means she needs support. She needs support. And she needs assistance. She needs help. She needs somebody to help, assist, aid. Okay. From whom? From whom? From a nurse. And the nurse in charge, you are writing. Okay. Right. You are writing to the nurse in charge. Remember that. You are writing to the nurse in charge. So she will send a nurse to take care of things. So that is it. In charge, she will not go. She will send somebody. So try to understand what she is telling. Fine. So what she requires? Support. Support for what? What type of support? Monitoring. She requires monitoring. And what? Okay. And what else? Okay. Home visits from community health nurse. Community health nurse. So this is community health nurse. So the nurse, she requires somebody to take care of it, take care of her. Right. So now we are going to start writing the sentence. What does she require? What does she require? So here, requires what? She requires, okay. assistance or support. She requires assistance or support. Who is going to support? Who is going to support? Nurse. Which nurse? Community nurse. Community health nurse. And nurse is singular. So write A. A community health nurse. So requires assistance. Okay. She requires assistance. Whose assistance? Of a community health nurse. So of this word. Of. So now you have taken a community nurse from the, yes, from the case notes. From here you have taken community health nurse. For what? For monitoring. For monitoring. So regular monitoring. So why? So for what? What does she require? So regular monitoring. Regular monitoring is required. Okay. So discharge tomorrow. So today you are writing the letter. Remember that. So tomorrow is the word, which is very important word. This is the tense. This tells about the tense. So this is talking about the tense. What do you mean by tense? Tense is related to time. There's a word in every sentence which talks about time. So tomorrow is talking about future tense. If tomorrow is future tense, then today is present tense and yesterday. So tomorrow is a day. The day after today is tomorrow. The day after today is tomorrow. The day means today. The day after today is tomorrow. That means future tense. So you are going to talk about this in future. So next one. So today. So actually present tense. Today is present tense. Today only this thing happened because she was admitted on 15th. She was admitted. She is admitted today itself. So today you are there now. Now today you are the nurse. Today only she admitted. And tomorrow she is. So remember that, live in that situation. So now is it present tense or past tense? It is present tense because you are dividing time based on day. When it is day, then automatically today. Today she underwent is wrong. Today she has undergone is right. Okay. So remember that one. So today. So what happened here? This angioplasty is today. You remember the time. Today. This is very important. This is related to time. And this is tomorrow. Is related to future. So this is how you are dividing time. So you are writing today, so everything is in present tense. Whatever related to today, you have to write in present tense. Whatever related to tomorrow, you have to write in future tense. Whatever yesterday. Now I am dividing the time for you. So today is, because today is 15th. You remember that. So this is the date. Copy text. And this is the date. So this is today. So this is present tense. Present tense. And this already finished. The action is completed. So it is perfected. Action accomplished or perfected. Therefore, this is present perfect tense. Present perfect tense. Present perfect tense. That's very clear. So you have to use has undergone. Don't say underwent, because you're talking today. Yesterday, if it happened, then it is happened, past tense, underwent. But here it is not past, because today, this is the key word. So write present perfect tense. Now let us see how we are going to do this one. Take all these things. So we'll start with this one now. We got all the information almost. If anything is required, we can take it. So start with Miss Margaret Helen Martin. So don't say I am referring, because this is not a referral letter. So what you can do is, the best possible way is to start with the name of the patient. So take Miss Margaret Helen Martin. So we have taken the name of the patient. We have taken the name of the patient here. Miss Margaret Helen Martin. Stop there. Right. So now let us see here what she requires. So what is done is not that much important. So future is more important. Now what is present is done, perfected, everything is fine, it's successful, everything is done. So don't focus on that one more now. So what is going to happen is more important. That's why you are writing a letter, because something important things have to be performed from now onwards, after discharge, from tomorrow onwards. Okay, what you are going to do today, what you have done today, that is not important for them. So what she requires later is important. So here requires, she requires. So this is the first part. That is it. So now you are talking about future. It is not only today, it is tomorrow, day after tomorrow, always, until she completely recovers. So you are using requires, the word requires. Past tense is required. Present tense is requires. Future tense is will require. But it is not only just future. Okay, it's always, until she recovers. Tomorrow, day after tomorrow, after 10 days, maybe after 20 days, maybe. We don't know, until she recovers completely. So requires. Requires means always. Indefinite period. Indefinite period. So there is no limit until everything is fine. That is why you have to use simple present tense. What does she require? What does she require? Yes. She requires home visits. Okay. She requires the nurse. She requires the community health nurse. What for? To monitor. So monitoring. So she will do a lot of actions, activities. So for all these actions, community health nurse is required. So what is going to do? She is going to provide support. She is going to provide assistance. So you can use these words. What are the words? Assistance or support. Here, assistance or support. So here, assistance, or you can say support. And so here, assistance. She requires assistance. Okay. And then whose assistance, whose, oh yes, whose of nurse's assistance means assistance of nurse. So you can write like this, requires this one, a community health nurse, a community health nurse, apostrophe S, nurses assistance. Now this apostrophe S means of, assistance of a community health nurse. Try to understand how I'm changing this sentence. A nurse's assistance, she requires a nurse's assistance. So this apostrophe S means of. So what I'm doing, I'm removing this apostrophe S and I'm putting here of. And this a community nurse, I'm shifting this side. Now the sentence is clear. Miss Margaret Helen Martin requires assistance of a community health nurse. So here you have used a because it is nurse. Therefore, here also assistance is a noun. So you have to use a, an, or the. So a assistance or an assistance. Only one assistance, an assistance you cannot say. Because assistance is uncountable. Assistance is uncountable. Assistance is uncountable. I'm taking you to Cambridge Dictionary. You have to know what you are using. This is Cambridge Dictionary. Now I'm going to tell you what is what. Assistance. Assistance is uncountable. U means uncountable. You cannot count it. A assistance, two assistances, three assistances. It is meaningless. It is rubbish. You cannot count like that. So you cannot use a or an. So definitely you have to use the. I hope you understand why I used the here. Miss Margaret Helen Martin requires the assistance of a community health nurse. So this is it. Try to understand how the sentence is made. So a community health nurse, you know, it is taken from the right. Remaining things you added. Miss Margaret Helen Martin requires the assistance of a community health nurse. Miss Margaret Helen Martin requires the support, okay, the aid of a community health nurse. So this is one sentence. Yes. So you have got a valuable sentence. Now, another sentence. Why she needs this assistance? Why? Why? So, she, okay, not past tense. So, has undergone, okay, she has undergone, because present tense, you know that, okay, she has undergone. Don't say has underwent, it is wrong. Go, went, gone. Has will take the third form. Had will take the third form. Have will take, whenever has, have, and had are there, it will be the third form. Go, went, gone. Undergo, underwent, undergone. Third form should come. So remember that. Okay. She has undergone. Okay. angioplasty. She has undergone angioplasty. Yes, she has undergone angioplasty today. Because today only she has undergone. So how can you say she underwent? How can you say she underwent? Because you are saying today. When you are saying today, you cannot say past tense, underwent. If you don't use the word today, then that is different. But you are using today. So it is present tense and it is completed. So undergone, has undergone. She has undergone angioplasty today. Right? That is finished. That is one sentence. Okay. She has undergone angioplasty today. For what? For what? You know, for what? For corona artery disease and angina, whatever it is. So for coronary artery disease and angina. Okay. For coronary artery disease and angina. So whose coronary artery disease and angina? For her coronary artery disease and angina. So just I am giving you the relation. Afterwards we can remove she, it, he, all these things we can remove later. Fine. She has undergone. I'm telling you why present tense, why past tense. Nobody thought of all these things. Where to write present tense, sir? Where to write past tense, sir? Where to write future tense, sir? Everyone is getting confused. So I'm clearing here. It is very clear. It is today. Tomorrow means days. So the tense is divided by days. Today is present tense. Tomorrow is past tense. Future tense. Yesterday is past tense. So try to understand that one, based on that one. So you cannot write past tense, you have to write present tense. So present tense means you have to write present perfect here because it is completed, accomplished, mission accomplished. Now, so now here, already, fine. Now here this angioplasty today, right. Now, how was this? How was this angioplasty? So medical information, angioplasty, okay. Now angioplasty, repeated. That means first it was done. Okay, first it was done. Now angioplasty is repeat. So now routine post-operative recovery. Routine means normal. Post-operative recovery, that means was uneventful. Okay, nothing, no problem. Everything is going on fine. Okay, everything is going on fine. Right. Routine post-operative recovery, everything is going on fine. Every post-operative recovery, this is also going on in the same fashion. So try to understand that particular point. So there is no problem. So it was, now you have to see many other things. No signs of infection, no signs of bleeding, no post-procedure, everything is fine. Okay. That's very clear. And patient is anxious to return home. Okay. Now, you are discharging. Why are you discharging? Because everything is fine. She is recovering. She is recovering. That means the operation was successful. The operation was successful. Everything is fine. There is no problem. If there is problem, they will keep her there itself. Why will they discharge? So it was a success. So now what you have to do is successful. Okay, successful. Successful. So the angioplasty was successful. Now let us see angioplasty. What is angioplasty? For example, if it is surgery, surgery is uncountable. Surgery is uncountable. Remember that. I am showing you a lot of things. Surgery. If you write the word surgery, yes, surgery is uncountable. U means uncountable. That means you cannot write surgeries. Okay. It is uncountable. Medical operation. You cannot say one surgery, two surgeries, three surgeries like that. You can say 2 times he underwent surgery. But you cannot say 2 surgeries. Okay, be careful. Be careful. And you cannot say a surgery also. A and will not come. So no question of using article there. But if you say angioplasty, angioplasty. What do you mean by angioplasty? Is it countable or uncountable? You see here, uncountable or countable. Uncountable or uncountable. Uncountable or countable. Both are possible. You can use it as uncountable. You can use it as countable. Right? Try to understand very clearly. So here you can use an angioplasty, you can say, but successful is there. So a successful angioplasty. A successful angioplasty. I am showing you the proof why it is right, why it is wrong. If you say angioplasty, then it is wrong. Because it is countable. So you have to write an angioplasty. But because successful is coming in between, you have to write a successful angioplasty. So this is how you are going to write the sentence. Fine. Now, so now these are 2 sentences which we have written. Now third sentence. What is the third sentence? Now, first one is Miss Margaret Helen Martin requires the assistance of a community health nurse. That is one sentence. Second sentence is she has undergone a successful angioplasty today for her coronary artery disease and angina. Then the third sentence is related to what? Related to the discharge. This one. Related to the discharge. Return home tomorrow. Return home tomorrow. So the third sentence is she is due. She is due means scheduled to be discharged tomorrow. She is due to be discharged tomorrow. We know that here. Okay. Discharge tomorrow. Home. So she is due to be discharged back home tomorrow. She is due to be discharged back home tomorrow. She is scheduled to be discharged back home tomorrow. She is scheduled to be discharged back home tomorrow. She will be discharged back home tomorrow. Because tomorrow future tense, okay. She will be discharged back home tomorrow. She is due to be discharged back home tomorrow. Okay, going to future, coming close. She is due to be discharged back home tomorrow. These are the 3 sentences which you are going to write. Now, how you are going to write? Now, these sentences you can join also. So, this is preceding. Angioplasty, this is preceding. And this is following. One is following and one is, okay, right? So, she has undergone a successful angioplasty is first. And she requires the assistance is next. So, assistance. So, this assistance is following. You can use the word following or followed by. That also is there here. So you can write different styles. Fine. Now I want you to write your own introduction. How you want to write, you can write. Okay. I want you to write your own introduction. First paragraph. Introduction. Okay. First paragraph. Introduction. These are the points now. You can write the introduction. But before writing the introduction, I want you to write the sentences. Separate sentences, write down. Then afterwards, 3 or 4 sentences you can write. And afterwards you can write into 2 sentences or 3 sentences or 1 sentence. So I'm going to help you for that. So now number 1, Miss Margaret Helen Martin. Number 1. Okay. Fine. Different sentences you can write. I'll give you all the information related to this. Okay. Right. You can use, instead of Margaret Helen Martin, you can use she, you can use who. Okay. Fine. These are the words which you can use instead of that one. Synonyms also I'll give you. Then next one, word requires, needs, requires, needs. Okay. Then next, another one is support, help, assistance. This is one. Next one is, this you cannot change. What you cannot change, you have to write as they are. You cannot change this one. And this one is, you cannot change this one. A community health nurse. Cannot change this one. A community health nurse. You cannot change this one. So come on, write one sentence using this. And keep it ready. Yes. Come on, write down. Write sentences. You can take followed by, because one is following the another one. Or you can say following, but different things. Followed by something or following something. So which is first, which is second is important. You can also use after. Then you can use the word angioplasty. Then you can say, what is that? Coronary artery disease and angina. Very good. Ankita is very fast. Very good, Ankita. Miss Margaret Helen Martin, who has undergone, whose W should be small letter, Ankita. W should be small letter. Has undergone a successful angioplasty for coronary artery disease and angina, requires ongoing assistance from a community health nurse after being discharged tomorrow. Very good. One mistake is W. That should be small. Come on, all of you, write down. All of you, write down. Active participation, because there are many more wonderful sentences which are going to come up. Write your own sentences. Jyoti Sridhar. Miss Martin, comma is not required. So there was some confusion. Okay, Miss Martin has undergone a successful angioplasty for coronary artery disease and angina. Full stop. Very good. She, capital letter. Okay, she requires ongoing assistance. She requires ongoing assistance and regular monitoring. When you are using these things, you don't need to write the. She requires ongoing assistance and regular monitoring. Okay. So that's it. In general, that is not specific. The assistance of a nurse means specific. But here, this is not required. Okay. She requires ongoing assistance and regular monitoring of a community health nurse following her discharge tomorrow. Very good. Excellent. Come on, come on, come on. Okay, Romila. Mrs. Margaret Helen Martin has undergone a successful angioplasty for coronary artery disease and angina. Very good, but Miss Margaret Helen Martin, comma should come there. Romila, comma should come there. Okay. No worry, I'm there with you people. So, so till here we'll take. Come on, write down. I'll be correcting your sentences. Okay. Remaining students, you can go ahead and continue because you don't know what I'm going to do. Who else has written here? Yeah. Okay, some more students. Wow, wonderful. Wonderful copy. Very good. I'm bringing your sentences onto the screen. You carry on. Write down. I'll show you what it is. What is this blessing? Uh-huh. what is the symbol? Who is that? Sumaira. Okay. Yes, coming your screen, you can see here now, each one's a sentence. Starting with introduction, Ankita. Miss Margaret Helen, spelling mistake. Oh my goodness, I did not notice, sorry. I did not notice. It is going to be a wonderful session, I believe. Helen, spelling mistake. Helen, Helen Martin, who has undergone. So HW should be small letter. Miss Margaret Helen Martin, who has undergone a successful angioplasty for coronary artery disease and angina, requires ongoing assistance from a community health nurse after being discharged tomorrow. Wow, wonderful. Yes, Ankita, unmute. All others
Yes.
don't unmute, please. All others don't unmute. I'm opening everyone. But please don't unmute because background sounds should not be disturbing everyone. Ankita, is that clear, Ankita, your sentence? Hello, Ankita, you can unmute.
Hello.
Yeah. Do you understand what I'm
Yes.
telling you?
Yes, sir. There are two mistakes. One is spelling mistake of Helen, and second is letter should be small.
Actually,
W.
you could be careful, no? Correct or not?
Yes, sir. Correct.
Just in your hurry, you made a mistake, right? Both are very
Yes.
simple things. You could have done it yourself. You don't need me
Ye-
there, correct?
Yes. Yes, sir. Correct.
Okay, fine. Next one, Jyoti Sridhar. Miss Martin, no need comma, has undergone a successful angioplasty for coronary artery disease and angina. Full stop. Then capital letter. Yes, she requires the no need here because you're adding quality here. Ongoing assistance and regular. She requires ongoing assistance and regular monitoring. Okay. Of a community health. Okay. Right. Very good. Very good. Of a community health nurse following her discharge tomorrow. Wow. Wonderful. Okay. Jyoti Sridhar, unmute, please.
Yes, sir.
Yeah, is that clear, Jyoti?
Yes, sir. Clear, sir.
You have done 3 mistakes. Okay.
Yes, sir. Yes, sir.
You could have saved these things. Okay. Then
Okay,
next
sir.
one. Yeah, here you have written correct capital S, so that's covered. And Romila. Romila, you can unmute. Miss Margaret Helen Martin. Here, comma should be there. Double space should not be there, single space. And here, comma. Miss Margaret Helen Martin, because who is there? Miss Margaret Helen Martin, who has undergone a successful angioplasty for coronary artery disease and angina. Very good, requires assistance. Here, double space should not be there. Of a community health nurse following her discharge tomorrow. Very good. Next, Mary Dorin. Mrs. Why did Mrs. come here? It is Miss Martin. It is Miss Martin, not Mrs. Martin. So, it is Miss, not Mrs. Miss Margaret Helen Martin has undergone a successful angioplasty today for coronary artery disease and angina. After full stop, space should be there. She requires a community health nurse, okay, for ongoing care following her discharge tomorrow. She requires a community health nurse. She doesn't require community health nurse, but she requires ongoing care of a community health nurse. She doesn't require community health nurse. She doesn't require a community health nurse. Why she requires community health nurse? She requires ongoing care of a community. So she requires care of community health nurse. She doesn't require, if she does, that is it. Okay, this is fine. This is fine. This is not a problem. But you could have improved the quality there. Okay, Mary Dorin. Hello, Mary.
Yes, sir. Yes, sir.
Is that clear?
Yes,
She
sir.
doesn't
Yes, sir.
require community health nurse. She requires.
Yes, sir.
She requires what? She doesn't require community health nurse. She
Ongoing
requires care. Correct or not?
sir.
That should have come forward. Okay, it would have been better, right?
Okay, sir.
Even this is right.
Okay,
This is not a problem. This is 100% right. But if you write like that, it will be 200% right. Okay.
Okay, okay, sir.
Okay, fine. Next one.
Okay.
Community health nurse for ongoing care following her discharge tomorrow. Very good. Okay, next. Prabjeet Kaur. Going for exam next week. Miss Margaret Helen Martin, who has undergone here double space, no need, angioplasty. As a result of doesn't suit here. Angioplasty as a result of no fur. Okay. It's not as a result of. Okay. As a result of. No. It is not a result. It is not a result. Fur is better. Okay. Okay. For coronary artery, as a result means automatically happens there. For coronary artery disease, it is not automatically happening. Okay, cause and effect, that's all. It's not cause and effect relationship. So you cannot use for coronary artery disease and angina, correct. She requires the follow-up care, okay, and appropriate management. When you are adding 2 or 3 more, don't use the avoid. Okay, follow-up care. She requires follow-up care. Care is uncountable here. Okay, no need anything. Fine. The assistance is okay, but here we are adding another thing. Appropriate management also is there. Okay, she requires follow-up care and appropriate management by a community health nurse following the discharge tomorrow. Good. Is that clear, Prabjeet? Prabjeet,
Yes, sir.
is that clear?
Yes, sir.
Okay, fine, good. Sumaira, you can unmute. Miss Margaret Helen Martin, comma, first day, very good. Very good, first day, but she is doing very nice. Very well, nicely. Miss Margaret Helen Martin, who has undergone, present. Undergone always will be with has or have or had, because it's the third form. When you use the third form, so for example, sung, has a sung, not just sung, has undergone, has gone. Gone will use go, went, gone, third form. So has is a must because it is perfected. Okay, perfected, perfect tense.
Sure.
Who has undergone
Okay.
angioplasty. What is this blessing? An angioplasty.
Yeah, that was mistake.
Okay, no
Successful
problem, no
angioplasty.
problem, no problem.
I
Okay.
corrected
I have
it
cut it
down.
off,
I
no
corrected
problem,
it.
no problem. It's okay, it's okay. An angioplasty. Today, for her coronary artery disease and angina, very good. She is, no need. She will be going back. She will be going back. To is not there. To no need. Going back home, enough. Back to home is, to is not needed. Back home. She is going back home. For example, house is there. Going back to house. For home, to is not. Going back home. Back home. That's enough. Okay. Something else, it's okay, but home doesn't take two. Okay, going back
Sure.
home tomorrow.
Okay.
And she needs.
Yeah, she needs
She is third
assistance
person
of
singular
me.
number. So you have to use S. She
Yeah,
needs
I recognize that.
assistance of a community health nurse for ongoing home care. Very good. Very good, Sumaira. Okay.
Thank you.
Very good. Very good. I congratulate you. First sentence, but very nicely you have performed. Next, Manikanta. Manikanta. Miss Margaret
Yes, sir.
Helen Martin, comma. Then you have to use she, who. Miss Margaret Helen Martin, who has undergone a successful angioplasty for coronary artery disease and angina. Okay. Okay, you have put full stop. So then she, capital letter. Because you have put she separately, so only it ends here. So who is not needed, comma is also not needed, because it is just one sentence. So Miss Margaret Helen Martin has undergone a successful angioplasty for coronary artery disease and angina. There's a sentence in itself. Good. No need anything else there. If you are adding another sentence, then you have to, Miss Margaret Helen Martin, who has undergone a successful angioplasty for coronary artery disease and angina, comma, requires ongoing assistance, like that, or needs ongoing, so that she will remove here and who will come there. So if you want to write who here, she will go off from here and continues there. That's all. Because you are not joining, no need of another she or who. Right. But if you can write who here, that's good. Miss Margaret Helen Martin, who has undergone a successful angioplasty for coronary artery disease and angina, then you remove this she and you remove this full stop. Okay. Is that clear, Manikanta?
Yes, sir.
Needs ongoing assistance and frequent monitoring, okay, of a community health nurse following her discharge. Very good. Very good. One sentence you have written everything. It's really awesome. You have written once, two sentences you have written, but I've joined it in one sentence. That means there is a possibility. You have done it very fine. This, if you write like this, it is an A grade sentence. Because one sentence you have written everything. That's awesome. Okay. So because you are a new student, I'll keep it like that only. Like how you kept. This is better. Break down the sentences. Okay, because you have recently joined. That's good. Very good. That's really wonderful. Next, Mary Dorin. Mrs. Margaret Helen Martin has undergone a successful angioplasty today for coronary artery disease and angina. Full stop. Space. She requires a community health nurse for ongoing care following her discharge tomorrow. Okay, fine. Good. This is first round gone. Okay. Home. Right. Review. Track change. Okay. Yes. Very good. Many students are actively participating. I'm really very happy. Now I want to ask you one thing. Okay. Are you happy with this practice? Solid practice. Or do you have any suggestions? For example, going very fast, or no need this much explanation, or anything. If you have your any suggestions, please. Is it fine? Or you have any suggestions, you type there. If you have any suggestions, you type there. Okay. If you have any suggestions, you type there. If you have no suggestions, you want it. If it is okay, sorry, what did I do? Yeah, I'm done fine. Okay. If it is everything is okay, then you say okay. If everything is okay, you say okay. Sir, this much explanation we don't need. Just you teach us, sir, afterwards we practice. Whatever you want to write, you can write. Otherwise, you can just say okay. Okay. If you want to say okay, it's okay. Otherwise, if you have any suggestions, please write. Because I need your points. Right. So remaining students also. If it is okay, you write okay. Otherwise, if you want, we don't want this much explanation. We don't want your correction. Afterwards, we can see correction. Whatever you want to say, you can say. Right. So here 11:25. 11:25. We stopped with Mary Dorin. We stopped with Mary Dorin 11:25 tomorrow. So we have to take from Sumaira. Yeah. Yeah, you can comment whatever it is, Jyoti, no problem. I am always welcome. $25, yeah, here it is. All the suggestions are welcome. Write down your suggestions, please. Yes. Yes. Where is the suggestion? Where is the suggestion? I'm waiting for suggestion. Yeah, write down your suggestion, Jyoti. I welcome it. So fine. So now coming to Sumaira. Okay, sorry about emoji. I do not notice. No problem. No, why you say sorry? My children, you are. Okay. Fine. Next, Miss Margaret Helen Martin, who has undergone a successful angioplasty today, followed by coronary. It's not followed by. It did not follow on its own. Followed means happen normally. Okay. Injury followed by a fall, that is okay because it happens automatically. Okay. So here you can say for. Okay. Sorry. For coronary artery disease and angina. Okay, requires the assistance of a community nurse. Very good. Miss Margaret Ellen Martin, comma, who has undergone a successful angioplasty for coronary artery disease and angina, comma, needs the support of a community health nurse. Then here, if you want to say another verb, you have to say she is scheduled to be discharged. Full stop. Full stop. After the discharge tomorrow, you can say after the discharge or following the discharge tomorrow or after the discharge tomorrow, like that you can say, or put a full stop and then say she is scheduled to be discharged tomorrow, like that. Very good. Yogendra, sorry, Sitara. Hello, Sitara. Hello, Sitara, you can unmute.
Hey.
Is that clear? I have given you the feedback. Is that clear?
No.
Sitara,
Yes, sir. Good evening,
have you
sir.
got my points, what I have written?
Yes, sir. Yes, sir.
Oh, clear. No problem. You had only one mistake that I have set it right. The next one.
Okay, sir. Thank you,
Okay,
sir.
Yogendra. Yogendra, is that clear, Yogendra?
Yes, sir.
Otherwise, what you can do is, instead of that one, you can say, you can remove this and you can say, after the discharge tomorrow or following the discharge tomorrow. Like that you can say. Okay.
Okay, sir. Okay.
Okay. She is scheduled to be discharged tomorrow. Okay, fine. Smitha. Miss Margaret Helen. Full name is Martin.
Sir.
Martin. Miss Margaret Helen Martin, who underwent.
Hello, good evening, sir.
Good evening. Yes, please. This is Sitara, right?
Yes, sir.
Yeah, tell me, Sitara. Who has undergone? Anything you want to say?
No, sir.
Okay. So, who has undergone? Very good. Who has undergone? Coronary artery bypass surgery. Smita,
Yes, sir.
what do you mean by angioplasty? Does it mean coronary artery bypass surgery?
Coronary artery bypass surgery. Yes, sir.
What do you mean by angioplasty?
Angioplasty is different thing, sir.
Okay. So, coronary artery bypass surgery requires a community health nurse's assistance for ongoing care and support following the discharge tomorrow. Okay. Did she undergo coronary artery bypass surgery here? Is it given in the case notes?
No.
Coronary artery
Angioplasty, sir.
disease is there, but bypass surgery or anything she
No, sir.
angioplasty
It's
is spoke.
angioplasty.
Huh?
Yes, sir. Angioplasty, sir.
So what do you want me to do here now?
Sir, angioplasty, sir.
So
Sir,
angioplasty means,
angioplasty is a stent. It's a
1 minute. Angioplasty means a medical operation used to remove something blocking an artery. Okay,
yes,
that is
sir.
coronary
Yes, sir.
artery, right?
Yes, sir.
So that means it is given. So here angioplasty is a medical term. Okay.
Yes,
So
sir.
if you use the word angioplasty, it is more valuable. Okay.
Okay, sir.
Angioplasty is a medical operation to remove something blocking coronary artery. Okay.
Okay.
That is the meaning. So instead of using angioplasty, you used something even longer one. That means simpler one. Angioplasty is even higher term. Okay.
Okay.
Because that is a specialized term. Okay.
Okay, sir.
So using that word is even more valuable, right?
Yes, sir.
Okay. You have simplified it. Okay.
Okay, sir.
But the word angioplasty is even more valuable here. Okay. According to what Cambridge Dictionary says. Okay. In a person
Okay,
who
sir.
has angina, see here, a medical operation to remove something blocking an artery in a person who has angina. Now you understand?
Yes, sir. Yes, sir.
That is it. You could have used one word angina instead of all these things, right? Huh?
Yes, sir. Yes, sir.
Okay.
Yes, sir.
So fine. Coronary artery bypass surgery. That's fine. Okay. That's
Okay,
fine. No
sir.
problem. But you could have used angioplasty, which is even better word. Okay.
Okay.
Right.
Okay, sir. Okay.
Requires a community health nurse's assistance for ongoing care and support following the discharge tomorrow. Very good. Next one, Sumaira. Miss Margaret Helen Martin, who has undergone a successful angioplasty today for her coronary artery disease and angina. So then you don't need to have, no need to use who, because it is simple sentence. So if you are adding another sentence to it, then you have to use who. Otherwise, there is no need. So if you want to use who, you have to remove she from here. Okay. She is will be going back. Okay. She will be going back home. I think I have corrected this sentence.
Yeah, you did it.
Home tomorrow, and she needs the assistance of a community health nurse for ongoing home care. Okay. Chitra. Miss Martin has undergone a successful angioplasty for coronary artery disease. Okay. What is the problem with this? Okay, comma. And so you have to put comma here. And she requires a community health nurse for continued care. Don't use continued care, better you use continuing care. Hello, Greta.
Hello, sir. How are you, sir?
I'm fine. I'm in a session. You can join, please.
Okay, now you're having session.
Yeah,
Okay,
you can
which
call me
session,
later.
sir?
Writing. Okay. Don't use continued care. Better you use continuing, because nowadays I have seen I heard somewhere or seen somewhere that continued is outdated. So use continuing care. So, okay, fine. For fall, continued care. So for is not needed. For continuing care following the discharge. Today. Yeah, that is Chitra. Hello, Chitra. Is that clear? Next, Datar Singh. Miss Martin, who has undergone a successful angioplasty for coronary artery disease and angina. So when it is only one sentence, no need of who. Okay. So if you want to use who, only one thing what you have to do is you remove this one. Right. So you continued that one. That means you made two sentences into one sentence. Miss Martin, who has undergone a success, wonderful style, but you have already used who has, comma who, then you can remove she will here, because she went there and became who. So she is not needed here. Okay, she requires, because if will you use no need requires, yes will not come. So it's general always, so she requires. Okay, Miss Martin requires assistance and monitoring from a community health nurse following her discharge tomorrow. Fine. Monitoring from by a community health nurse. Okay. Next one. Miss Margaret Helen Martin, comma, who has undergone a successful angioplasty today, followed by, no, Sitara, this is wrong. No, coronary artery disease did not follow angioplasty. This already happened before. Okay. So, for is better. For coronary artery disease and angina. Coronary artery disease did not follow angioplasty, because you said angioplasty is followed by coronary disease. Coronary disease is before. Angioplasty is after. But anyhow, followed by will not fetch here, because it is for, not cause and effect. Followed by, no. Or first and second action like. And angina requires the assistance of a community nurse after the discharge tomorrow. Okay. Here instead of after, you can use followed by also. Right. Is that clear, Sitara?
Yes, sir. It is clear.
Okay. Right. Okay. Next, Vignan. Miss Martin, who has undergone a successful angioplasty for coronary artery disease. Very good. Then why full stop? Because you already used who. So no need full stop. You have to continue. Requires. Finished. Direct, correct? Wonderful sentence. So when you use who here, you don't need she again. It's continuation. Otherwise, you want to use like this, you have to break it into two sentences. Actually, you wrote in a one sentence style and still you are breaking into two sentences. That is the problem here. So if you want to write like that, so then what you have to do is Miss Martin has undergone, that's all. And then here she will require. Finished. This is two sentences. But you have a quality here. I don't know why you have a I don't know. So this is ordinary. This is B plus. This sentence is, these two sentences are B plus now. Okay. But actually, it could have been converted into A grade sentence. That is fine. Only the problem is remove this full stop and remove she and remove future tense. Okay, finished. With future, you will not use yes. Will is there? No yes. Requires will not come. Okay. Okay. Once again. Miss Martin, who has undergone a successful angioplasty for coronary artery disease. See how I am showing you now. Miss Martin, who has undergone a successful angioplasty for coronary artery disease and angina, that is missed. Who could have written? Okay. Comma. Requires continuation of care and monitoring, ongoing care and monitoring from a community health nurse following her discharge tomorrow. Very good. One more mistake is no full stop. Is that clear, Vignan?
Sir, I have to ask you one thing, sir.
Yes.
When angina has diagnosed coronary artery disease, why should I still mention angina, sir?
It is this angioplasty is completely given for these things. Okay. So definitely if you are asking a valid question, you are asking angioplasty is for angina only, right? Correct or not?
Yeah, angioplasty is for angina, coronary artery disease is also for angioplasty.
Okay, right. So both, it is angioplasty is for both of them together, right?
When it was undiagnosed, it is called angina. When it is diagnosed, it is called coronary artery disease. Then why should I mention both?
Okay, so 1 minute. In the case notes, he has given both, right? Yes or no?
Oh, yes, sir.
This is an official OET paper. Okay, there may be some reason behind that. Okay.
Sir, 1 minute, sir. Angina is the disease, but angioplasty is a procedure. So we need to mention both, I think.
Okay.
Because angina is a
1 minute.
But sir,
1 minute.
angina is a symptom. Angina is a symptom.
Angina
Yes,
is a
sir.
symptom. Okay. Now let us see. Why we'll ask a Cambridge dictionary? We have powerful one. Angina is a condition that causes strong chest pains because blood containing oxygen is prevented from reaching the heart muscle by blocked arteries. This is angina. This is
Yes, sir.
angina. Angina is a condition that causes strong chest pains because blood containing oxygen is prevented from reaching the heart muscles by blocked arteries. So this is the condition. Angina is a condition, okay, which resulting in something, cause and effect. So right, now coronary artery disease. Coronary artery disease, okay. Coronary artery disease, oh, sorry, coronary heart disease. No, sorry. So what we have to do is, 1 minute. There may be valid reason, because if it is the same, then they would not have given in the case notes. Okay, let us take the medical dictionary now. Coronary artery disease. Okay, fine. Right. Coronary artery disease is the building up of plaque in the arteries that supply oxygen-rich blood to your heart. Yeah, this is something different. So plaque causes a narrowing or blockage that could result in a heart attack. Symptoms include chest pain, that is one, or discomfort and shortness of breath. Okay. That is what it says. Some little difference is noticed here. Okay, fine. So let us see that one. Coronary artery disease is the buildup of plaque in the arteries that supply oxygen-rich blood to your heart. Plaque causes a narrowing or blockage that could result in a heart attack. Symptoms are different. Okay, chest pain is one symptom.
Chest pain itself is angina, no, sir? Chest pain is called angina.
Chest pain is called angina. Okay.
Yes,
so this is different. Coronary artery disease is different. Okay. Now
ultimately it is causing coronary artery disease on doing angiogram.
Then definitely we have to go to a doctor, but we'll find it out. Okay. This is angina once again.
I can give a lecture one day for a coronary angiogram.
Okay, no problem. We'll see that later. A condition that causes strong chest pain. A condition that causes strong chest pain because blood containing oxygen is prevented from reaching the heart muscle by blocked arteries. They are related, but it should go into depth. Okay. So we'll not go into that depth of the vocabulary now. And to be frank, one more thing I'm asking you, don't focus much on medical, because this is not a medical test. One more thing I'm telling you, because the people who are correcting are not medical professionals, but they are English language professionals. Number one, medical terms are important, but here whether that is right or 100% right or not, that is different thing. Here you are tested for English language proficiency, because this is English language test. Even if that is slight mistakes are there, they will not bother much. So that is it. Okay. So this point which you have raised will be tested in medical test, not in English language test, because I want to clear you one thing, all of you. One thing I will clear for you, that is, this is what, okay, OET, English language proficiency test, not a medical test. Okay. Now let us see here. Now see here what it says. Here I have taken from the official OET. Right. This is this. So concentrate on what I am telling. I am not evading the question. I am not evading the question. I have copied from there and I am posting it here. Yes, what you asked. Okay, here it is. Okay. Okay. So this says the OET is a test of English language ability, not of medical knowledge. So don't use medical knowledge, high profile medical knowledge in English language test. That is what OET is telling. I am not telling. So we are not going deep into medical knowledge because the OET itself is telling. Okay, so they're not going to give mark for medical knowledge. You can use that. You're absolutely right. You can use that. If you have that one, you can use. But they will not go into deep whether the truth value of that one absolutely pinpoint it is right or not. It will not test. So I'm showing you from official OET results and assessment. Assessment means evaluation. Test information. Official OET. It says Control F. Control F. English. Okay. Okay. So now see here. Listening and reading, writing and speaking. So you have to see here very carefully. Here they say the same thing what I have told you now. Right. So I'll increase the size. So here I think this is enough for you people. The OET, this is OET experts, OET results. Okay. OET experts are telling. The OET is a test of English language ability, not of medical knowledge. And our test developers take care to minimize areas where candidates may use prior knowledge rather than language skills to respond. That is what it is. So concentrate more on English because this is an English language test. That's it. That is what I want to tell you. Because this is only specialist knowledge. So you need not worry about that one and they will not bother much of that one. So that is official occupational test tells you. So follow that. That is better for you. And if you think too much in that one, you'll only break your head and nothing is going to come out. And it is not a debate. It is English language learning and we'll focus more on English language learning. Then next. Okay. So please, we'll restrict ourselves to more of English and not of medical knowledge. I can definitely clear that one to you if I go in deep into it, but it is not our cup of tea. It's not required, neither for you, nor for us, nor for anybody. So let us minimize in that medical area. Okay, next one, Sudha. I appreciate you, but will not bother deep into that one because we will not come out of that one because it is experts, okay, research scholars topic, that one. Now, Miss Margaret Helen Martin has undergone a successful angioplasty today. I think there is double space. That's why it's showing. Okay, yeah, double space. Okay. For coronary artery disease and angina. She requires the assistance of a community health nurse for further care. Here also double space and monitoring following her discharge tomorrow. Very good. Sudha. Hello, Sudha.
Yes, sir. Yes, sir.
Very good. Very good. Next. Sudha from Muscat, huh? Or Sudha
Hello,
Johnny?
sir. Yes, Sudha Johnny, sir.
Yes, I have 3 or 4 Sudhas. That's why I'm asking. Okay.
Sir, I have one question, sir. I need the differences between follow-up care, ongoing care, further care, and continuing care.
Okay.
All are same?
Ongoing care, continuing care, okay, follow-up care. Follow-up means continue only, nah?
Yes, further
There are
care.
different variations of the same.
Okay, sir. Okay.
Okay, there are different variations, means synonyms you can say. Right,
Okay,
if
sir.
any difference is there, we'll you write all the words whichever you have, we'll discuss. Okay, Miss Martin
Okay,
is due to be discharged tomorrow. Then no need, if you use after, no need comma. Miss Martin is due to be discharged tomorrow after a successful angioplasty today. Very good. Fine. She requires a community health nurse's support. Good. Right. This is good, Ankita, but it is, you have to improve this quality. You have to improve this quality. How you are going? Because you have written 2 sentences and some quality words better. Some quality words better. Okay, you made it simple. You can expand a little more. Okay, next one. Correct. No mistakes. Only one mistake is comma should not come here because you are using after. After. Okay, as a preposition. After as a preposition, not as a conjunction. If you use as a conjunction, after she had a successful, then it is full clause. So then you can use comma, but otherwise no need. Even for that, no need. Amal Maria, Miss Martin, who has undergone a successful angioplasty for coronary artery disease and angina, requires ongoing care and assistance from a community health nurse after being discharged tomorrow. Very good. Okay, fine. Last one. Thank you for seeing, Ankita. Thank you for seeing Miss Martin, who has undergone a successful angioplasty. See how I am studying. Like that only you have to write. Thank you for seeing Miss Martin, who has undergone thank you for seeing. Thank you for seeing means first time. Because you are sending her to home. Thank you for visiting. Thank you for, okay. Thank you for your ongoing management of, like that it's better still. Okay, who has undergone a successful angioplasty for coronary artery disease and angina. Okay, she requires ongoing support following her discharge tomorrow. Okay. Actually, yeah, we finished. We finished. So till there. So now we'll move into the next part. 23 points again. Okay, these are all. Okay, these are general points. Okay. All right, last finished. Yeah, 11:42. Yes, we are going into the second paragraph now. There are some more students. 11:42. So that is Jyoti Sridhar. 11:42. Jyoti Sridhar. Jyoti Sridhar, you did not give your suggestion. Or have you given that?
I have given, sir.
Okay, we'll take it. Okay, no problem. Okay. So review, track change. Till here we have seen now. So paste. Yeah, anything is remaining, any sentence, 1 or 2 only. So now we are moving on forward. Okay. 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 Right. Right. Sir, please, Sudha, sir, please take classes regarding selection of case notes, paraphrasing and organization of a letter. on regular basis. Okay, we'll take Sudha. Every day morning, give us one reading. I'm giving. I already gave. Okay, writing. One reading, one listening, and one writing. I already gave for 10 days together. Same topic. And at the end of the day, kindly keep open Zoom meeting where all the students can discuss the wrong answers in reading, listening, and writing. Okay, this is Jyoti Sridhar's suggestion. Where you are the admin under your guidance, we'll get corrections for all the subtests. Yeah, I'm giving them and we'll get them. No problem. We'll do that one. And even speaking, you can give us quality sentences. Yes, of course. Thank you. Okay. Sumaira, bypass is different than angioplasty. Bypass is an open cardiac surgery and angioplasty is more simple. Sumaira Zaman, very good. Doesn't go with concept. Okay. Sir, please take classes regarding selection of case notes. Very good. Which information is needs to be. Pain is a symptom. Angina is a term to explain the cardiac pain. Okay. So now any other sentences are there? No. Great, Mr. Martin, sorry. Last one. We are moving to the second body paragraph 1. Okay, Mr. Martin, Miss Martin, who has undergone. Because present perfect tense. Who has undergone angioplasty for coronary artery disease requires assistance to continuing monitoring, assistance for ongoing monitoring or something. Okay, for continuing monitoring, continuous monitoring. Okay. To continue monitor, to continue or for continuing, to continue, to infinitive or for continuing. So if you say to continue monitoring, but better is okay for ongoing monitoring or continuing monitoring and okay, incomplete. Okay, fine. Right. So till there, it's okay. Now we are going to the second part of the sentence. Okay. There ends the first episode. So second page. So second paragraph. Body paragraph 1. Body paragraph 1. BP1. So what are we going to write in the body paragraph 1? Yes. Moving to the next episode. Yeah, here. We have social and family background, number 1. We have the treatment and we have the medical information and we have nursing management and we have discharge plan. Discharge plan will go into the last body paragraph. So we are dividing. So discharge plan will go to BP1. 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 Discharge plan means after a discharge what? Not here. Where is it? Yeah, discharge plan. So implementing discharge plan will be after a discharge. First comes first, last comes last. Present, past, present, future. Past, present, future. Is this an emergency? No. So they come in order. If it is emergency, present comes in, present visit comes first. But this is not that one. Okay, fine. Now think about this. Dietary, okay, discharge plan. Fine. Next, what are anticipated needs? All these things. Discharge plan and anticipated. Anticipated means expected. Expected means future. So this is discharge plan is about future. So discharge plan is for the future. Right, you have to remove. This is for the future, means after tomorrow. After tomorrow. That means after the discharge. So now, before the discharge, what happened? Before admission, what happened? These are the points. Past, present, future. Past, before admitting into the hospital. Present, you can consider. So today only, so it is present. Tomorrow is future. So past, what happened? Before admission, after admission, after discharge. So this is the division. That is called organization. So before admission to the hospital, what happened? That is called history, past. So during hospitalization, so why was he admitted? That is different thing. And after admission, what happened? How was progress went on, or is going, or how he is recuperating, that is important. The next one, after discharge, what he should do, that is future. Fine. Next, sorry. This is during hospital stay. That means this is present. During hospital stay means this is present. Remember that. And this is medical information. Medical information. Okay. Right. That means this is, he had celiac disease, he had angioplasty. I'm sure this is about a complete story. Personal, family history. You can see all these things are there here. So you know that from this one, it is history. Sorry. Family history. Right? Medical history. This is all about medical history. This is about personal, that is overweight. And this is medical information, what he is using. Ongoing medication. Ongoing medication. Okay. So all those things you have to consider. So anticipated needs of patient. So this anticipated means expected. Expected means future. This is also future, means after discharge. So after discharge. So these two are future. Discharge plan from here, future. Okay, from here, this is future. How we are differentiating things. Right. So this is more important. This is more important. This is more important because everything we have done, that is finished. Important is finished. There is nothing to think about that one much. Finished. Past is past. So future is more important. Ongoing management, ongoing care and follow up or whatever it is. Supervision, monitoring, everything. That is more important because you have to tell her. So all the things you have to include. Everything you have to include based on the receivers. Yes. So now, yes. Right. Now let us see. Never married, no children. Lives in own house in Greenville. Financially independent. 3 siblings. Contact with family intermittent. No longer drives. Has meals on wheels. Monday to Friday lunch and dinner. Orders frozen meals for weekends. So that is it. So now here this is the diagnosis, this is the treatment, this is the discharge, and this is the medical information. So this is social family background, means history and other things. Social history, family history, medical history, all are coming here. This is social history and family history. And this is medical history. Okay. So which is more important, medical history, then social history? So based on that one, you have to plan. And this is very clear now. This is present. In the hospital, what happened? During hospital, say. So during, start the sentence with, start the paragraph with during hospitalization. Sorry. Or while at hospital. During hospitalization, comma. Okay. Because this is during hospital station. During hospital stay. So remember that. You can use this one. You can use this one. Fine. So now there are three things. I'm giving you those three options now. Those three options are, number one. Sorry. Number one, the first option is this. So body paragraphs, which comes first, which comes next, which comes last. You have to think, you tell. Okay. Body paragraphs. Now first one, BP1 or body paragraph 1. Next one, body paragraph 2. Just for your convenience, I'm telling. Body paragraph 2. Next, body paragraph 3. Now you have to judge which comes. This is a discharge letter here. Okay, this is not an emergency referral. So there are three paragraphs. Last is conclusion. Forget that one. Now here I'm going to give you three things. A, you have to match these things. A is discharge plan, where it will go. B is histories, family, medical and everything. Social history, family history, medical history, all those things. Third one is during hospitalization. During hospitalization. So these are the things. Now you match 1A, 2B, 3C like that. Or you write now 1 discharge plan, 2 histories, 3 during hospitalization. Like that you have match. I want you to write 1, 2, 3. So now no need to write body paragraph 1, body paragraph 2, body paragraph 3. Just write 1. Okay, ABC. Okay. So 1 like this. Write down during 1 what. Okay. Then 2 what. Then 3. ABC means again confusion. Write like this order. Write in this order. 1 what. Discharge plan. 2 histories. 3 during hospitalization. Like that you write. I am giving you 30 seconds. This is called organization. Sudha, better write 1C means what, I will not know, because it's better you just write like this. That would be better. First paragraph, what will come? Second paragraph, what will come? And third paragraph, what will come? Yes, Manikanta, very good. Thank you. You really made me happy, Manikanta, by writing everything. 1 is during hospitalization, 2 is histories, 3rd is discharge plan. That is what you have written. Okay, very good. I liked it. So based on that one, we'll judge. 1A, 2B means everyone gets confusion. So be clear. Okay. So if you write like that, you will remember afterwards. Okay, if you write 1A, 2B, 3C, then again, a little confusion for everyone. So write clearly. It's okay, let us take pain. I am taking so much pain. Okay, Jyoti Sridhar, during hospitalization. 2, history. 3, discharge plan. "30 seconds. Yes. Type, no problem. I can wait. Everyone can wait because we are learning a lot of important things. Yes. Very good. Students are writing. Very good. I like it. You don't think that you are writing something. I am testing you actually. Who is interested, students? Who is interested and who is not interested? Who is following my words? Because there are many more sessions coming. And I'm making groups who are very serious. Okay? If you really want to involve in all those things, take active participation. If you are not ready to actively participate in writing 3 words or 3 sentences, how will you participate in serious sessions? Okay. "15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1, and 0. Yes. So we got them. Fine. Now let us see very clearly. Only one thing, time frame. What is first is always first. What is first is always first. So take the same thing. Same. First comes first and last comes last. Past, present, and future. That's the order. So simple as that. Past, present, and future. So future will go into the last paragraph, that is discharge plan. Finished. One is solved. Wherever there is a discharge plan, put it in the last. Remember that. That is organization for a discharge plan. Don't bring it into the front. Don't put it in the middle. Discharge plan is in the future. So future is the last option. So ruled out. One is gone out of the problem. So number 3, B. Okay. If we see BP1, okay, let it be a question mark only. BP BP2, question mark only. Now BP3 is ruled out, finished. Discharge plan is after discharge. That is the last to come. So, okay. So why all these things are needed is to be told before. So the causes and the effects. Post discharge, what he has to do is because of what happened before discharge. So cause will come first and effect will come afterwards. That is called cause and effect theory. Okay. Cause and effect theory. So discharge plan, all those things. Discharge plan. Okay, that's very clear. So in a discharge letter, discharge plan will be there. Absolute. So let this go to the last because it is the effect of what is the cause which has was before discharge. So before discharge is the cause. You did something, and the result is some situation. So that situation, you have to do something to overcome that situation or face that problem. So that plan is more important. And before telling all these things, you have to give knowledge about why these things should be taken. For example, if you go to your friend, you ask him, I need 1 lakh rupees. I need 1 lakh rupees or $1,000. I need $1,000. I need $1,000. The reason? He will ask. Why? He will ask you why. Definitely he will ask you why. That is called cause and effect relationship. Automatically he will ask you why. Then you will tell, my son's education is getting admitted into a college. So I need. So what comes first is first. What comes next is next. That is it. Anybody who has no time, manage your time, because this session will not come again. Because discharge letter, this is finished. Again, I will not repeat this for this batch. Next letter will be another letter. Next another letter. But this letter will not finished. Next I will teach grammar after these things. So 4 letters. Referral letter, I taught you. Discharge letter, I am teaching today. And yesterday I taught half of it. And transfer letter, maybe tomorrow or day after, not tomorrow, day after tomorrow. Because tomorrow I will focus on reading. Okay, next. So, I lost my job. I lost my money. So give me $10. If you say give me $10, he'll ask why. Then you will say, so anyhow you have to say. So tell it before, na? Give the reason and then talk. So this is the cause for which this is the effect. I lost my money, that is the cost for which I am requesting you now. So this is the effect. Because of this cause, this is the effect. So tell the cause before and tell the effect afterwards. That is it. So we are bothered only about discharge plan now. Don't go about body paragraph 1. Don't go about body paragraph 2. Okay. Now I'm going to ask you one word question. Say yes or no. Only 2 words. Yes or no. Discharge plan must go to body paragraph 3. Did you understand why or not? If you still have problem, Okay, you can say no, so that I'll explain further. It's so simple as that. Cause and effect. I met with an accident, therefore I am in the hospital. I met with an accident, therefore I am in the hospital. I was in the hospital. Why? I met with an accident. So why don't you tell it before? So the effect is the last one. Okay. So tell it the last position. That is the point. Therefore, there ends the matter. If it is a yes, then we'll go to the remaining two. Right. Then we'll go to the remaining two. Now, we are left with body paragraph 1, that is BP1. Fine. Still we don't know. So that's why I put question mark. Then next body paragraph 2. We don't know. Body paragraph 2, what it is. We don't know. We're learning. I don't know. I'm also a student. I don't know. So I'm learning. So let me think like that. Think. I'm putting my steps, my feet into my student's shoes. And I'm feeling that I'm a student and I'm explaining. Then only I can explain you wonderfully. If I feel that I'm a teacher, I know everything and I teach, then I cannot teach you. Then you cannot understand because I cannot reach you. If a small child is standing there, if you want to lift him up, you have to bend down first. Then you have to lift the student up. So I have to go down to the level of the student, and from there I have to bring the student up. I cannot stay on the top and say, come. Student cannot come. He cannot climb. This is a small boy. He cannot climb the mountain. I'm at the top of the mountain because my energy is full. I already reached there. So what should I do if I want to take that small boy up? I have to come down and take him up. So I have to go down and come up. So I have to think like a student, like how a student thinks. That's how. So it is easy. Known to unknown. Easy to difficult. Simple to complex. General to specific. Write down the points because you are going to use them in your letter, in your reading, in your listening, and your speaking also. These are called theories of learning. This is how you have to speak. This is how you have to. If I say, for example, if I tell you, Charminar is a wonderful building, construction, monument. It has this, you will not understand. Because you are from some other place. Then next, I should relate known to unknown, simple to complex, easy to difficult, general to specific. Then you will understand. That is why, if you understand what I am talking, then only you can understand. So I will tell you what you already know. Crude examples, basic examples. Then you can understand the complex examples easily. Now I am telling you. If I tell you like this, Eiffel Tower is like this, because I visited and I came in. People will not understand because they don't have an idea about Eiffel Tower. They don't have an idea because they did not see this, whatever. Then I have to tell. For Indians, I have to tell it. Taj Mahal is a famous building in India. The person, oh, India, our India. Taj Mahal, oh, I know, I have read it in the books. No, I know it. So, like this. In the same way, there is a building in France. France is a country like India is a country. It's because you are small children. I'm telling you like small children. That is what it is. Small children cannot understand. Your father, your mother, your teacher, you are in many things. You are big, you are adult, you are mature. But those people are small. You are small because you are learners of English. You are children. So I have to teach you like small children only. That's why you can understand very few. There are some people, we know everything. Then there is no need of Simon. No need, you can just go. Okay. Concept. You know speaking English, you know reading English, you know writing English, you know listening to English. But concepts you have to learn because you are tested on concepts, not on language, just. Grammatical concepts, vocabulary concepts, pronunciation concepts, connecting concepts. These are all concepts. So what you have to do is, you have to focus on these things. Which is first, which is next, before, after, cause and effect. These are all concepts I am teaching you. I am not teaching you English. I am teaching you the depths of English. Action, reaction. That is another concept. Advantages and disadvantages. Which will you say first? Advantages you have to say first. And disadvantages you have to say next. Because if you say disadvantages, they'll say don't want, don't want, don't want. Anything they don't want. Because you are talking about disadvantages. You are filling in them the disadvantages. So you are feeling dislike in them. So what you have to say, tell all the advantages. Computers are very good. Computers will help your children. Computers will increase their knowledge. Computers will sharpen their mind. Computers have a lot of information. They give you, then tell, computers have problems also. Computers will give you knowledge. Computers may harm you. Not will not harm you, may harm you. Possibility is there. That is it. Advantages more, is it? So what he will do? Okay, I will buy a laptop for my son. Earlier I thought I should not buy a laptop for my son because he'll spoil it or he'll waste his time. He'll play games. So all negative, 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 negative. So at positive first, then negative. Not negative and positive. Remember that. These are called concepts. Which first, which next. So there you will get the points. Now here also, the patient is in the hospital and he's being treated and he underwent, okay, he has undergone angioplasty. So this angioplasty, forget that one case, the discharge plan is finished. That is different. Now we have again two things. That is eliminated. When three people are fighting, one person is eliminated, he fell down. Only two are surviving. Now who is going to be first? Survival of the fittest theory. Now here in these two things, he is in the hospital. This is the result. Why he is in the hospital? Because some reason happened. Some cause is there again, and this is the result again. Here also cause and result, effect. Here also cause and, in these two things. So now, what is the effect? He is in the hospital. He is being treated. He has undergone angioplasty. This is the result. This is the result. If undergoing angioplasty is the result, after treatment is the reason, that is the result. So chain reaction we call it, chain reaction. Chain reaction. So now, if this is the result, what is the reason which landed you in the hospital? So again, first comes first. First comes first. So during hospitalization, what all the treatment you have given from admission, angioplasty, follow-up treatment during hospitalization, everything, care and everything during hospitalization will come second. That is the second. So all the others will be first. All the others will be first. Now this result becomes the reason for some effect later. This ball will hit this ball. Because this ball hit this ball will go and hit that ball. And that ball will hit another ball. This is called chain reaction. This effect will become the cause for another effect. So cause, effect, this effect becomes cause for another effect. That's it. So now, first comes first. So now I think you have understood very clearly. So, result, that is body paragraph 2. That is during hospitalization. during hospitalization. During hospitalization. So during hospitalization, case notes. Let me take the case notes here. Yes. So during hospitalization, you are given him medication, you are given this treatment, you are given all these medications, ongoing medications, treatment, and everything you have talked. So what are the things? During hospitalization, what you have given, right? And before that one, you write about the problem with the patient. You write about all the histories leading to his problem and his habits related to that problem, related to this problem, which made him land in the hospital. All those things you have to write. So build up the background story. Background story. BP1 is the background story. Background story means again all histories. All about him, about his family, about his problems, about his diseases. Okay. All diseases. What all he had problems, what all he had surgeries, what are, everything, all whatever relevant to this problem only. If this problem not relevant, then avoid it. Step by step. Yes, now cleared. Yes or no? Yes or no? So this is called organization. And within the paragraph, again, organization will be there. Which sentence should come first, which second should come sentence, which sentence should come third. Because otherwise you don't know which paragraph is what. Just I'll tell you, write like this, write like this. That doesn't mean you should know why you have to write like this. Small child also, moon is there. Why it is not falling, mama? She will say, reason. Why it is not falling down? If we throw a stone, it will fall down. Why moon is not falling down? Reason. You should have that. Even a small child has reasoning power. So we are matured individuals. Why cannot we reason? I'm not talking about only OET. I'm talking about life, because we have lost the skill of reasoning. Because we'll take everything accepted. Somebody told write like this. Somebody told write like this. We write. Nonsense. It's just like, a flock of sheep following blindly. Somebody told like this. Somebody told like this. Somebody. Why? Ask question first. Don't just trust anybody. Why I tell you many things and again go to Cambridge Dictionary? Why I go to OET? Why I am not taking some institution's name? Because standard is important. For example, if you want to measure 1 kg weight, you take a standard 1 kg stone and then put it in one. Then you measure every different thing with that stone, because this is a standard. It will not change. It will be 1 kg only, 1 kg only, because this stone is 1 kg stone. You will not buy, measure cotton with wool, cotton with wood, cotton with some other things. No. You will take only standard, approved standard. And based on that one, you will measure other things. And what is the standard here? Your teacher is not your standard. Your friend is not your standard. Your partner is not your standard. Simon is also not your standard. Institutions are not your standards. OET is your standard. Cambridge Dictionary is your standard, because this exam, Cambridge Box Hill exam. So that is your standard. Follow them. Fine. Next. So we understood what it is. Now we are moving forward. So we are going to create the background story of building the structure. So background story. In order to cook, first you will buy the vegetables and procure everything and keep them there. Easy to difficult, simple to. When I am telling you these examples, it is very easy for you to understand what I am talking about. Because every room is not the same. One is bedroom, one is kitchen, one is dining room, one is hall. One room will not serve multi-purpose. Every room has its own identity. First one is leading to the treatment, after effects, the causes. Treatment in the hospital. Admission to discharge is treatment. Admission to discharge is treatment. Reasons, after effects. That's it. Before the treatment, after the treatment, post, pre, while, and post treatments. That's all. These are the divisions. These are the divisions. Pre-treatment, while treatment, post-treatment. This is the division. You can understand very clearly. Family history is the cause. Because his relatives had this problem, he also had. That is why he is landing into this hospital. Remember that. Fine. Now we are moving further. Yes. So that's very clear here. Now what are important? What are important? Right. Now see here very carefully, I am going to show you. Okay, we understood while hospitalization. This is while hospitalization. This is post-hospitalization. And this is all pre-hospitalization stories. Okay, now let us see here. In this, what is more important? What is more important? Which is serious problem, that is. Never married is not a problem. No children is not a problem. Lives in own house in Greenville is not a problem. Serious problem which will take you to hospital. Never married will not take you to hospital. No children will not take you to hospital. Lives in own house in Greenville will not. Financially independent will not take you to hospital. They are not important. They are not important. Listen like this. 3 siblings and 5 nieces. Nephews living in greater Greenville area. Will they take you to hospital? No. Contact with family intermittent. He will not go to hospital because of this. No longer drives. He will not go to hospital for this. Has meals on wheels. So what? It will not take you to hospital. Meal delivery service for elderly. It will not take you to hospital. Monday to Friday, lunch and dinner. No way. Orders frozen meals. All these things will take you to hospital. No. They will not take you to hospital. Then what will take you to? That's just background. Right. Now next. Celiac disease. Angioplasty. Anxious about health. Tends to focus on health problems. Coronary artery disease. Yes. Overweight, yes. Try to understand this one. Yes. So try to see how it applies. These are the 2 points. Okay, take your notes now. We are going to write these points. Yes. 1 point is number 1. So his personal, this one. So overweight. Overweight. So obesity. You can take synonyms, write down synonyms. I'm not going to give you too many points. Overweight. You say obesity. Overweight is obesity. Right. Now, what is related to overweight and obesity? Now, find out that one. What is overweight to obesity? that is body mass index. Body mass index is 29.5. 29.5. 29.5. So try to see that one very clearly. Overweight and obesity is 29.5. Right. Now, why is he overweight? Why is he obese? Body mass index is like this. So what is the cause and effect of these things? Now let us go there and see. Because he is overweight, now this is related to this. Where? Financial content no longer drives. Okay. Lifestyle. Yes, sedentary lifestyle. Yeah, here it is. Yes, immediately afterwards. Sedentary lifestyle. Sedentary lifestyle is overweight because his lifestyle is sedentary. He doesn't do anything. He will not shell off his, calories. He will not burn his calories. They are accumulated. Reason, it is related there. These two things you have to relate. Sedentary lifestyle. We can add one word there, sedentary lifestyle. Everything he does is nothing. You can see here order growth in brackets, that is not important. Orders groceries over phone to be delivered. He will not go to the market and buy the things and come. Just phones and they will bring in, put him here. Neighbor walks dogs, he will not go. So try to understand, he doesn't do any physical activity. Okay, not participating in physical exercise. No physical exercise. So you have to think, then you'll get valued points. It's not that what is there in you have to bring out and you have to write everything, why it is, based on what he is telling. Okay. Sedentary lifestyle resulted in overweight and is increasing and increasing. Right. No physical activities. Not interested in performing daily activities of daily living. Okay. Like cooking, walking, exercises also. Nothing. He doesn't want to do anything. So that you can write. So this is personality disorder. Personality disorder. What do you mean by personality disorder? What he has to do, he doesn't do. Man is tend to be active, but he is inactive. So this is the first point you can write. This is the first point because it starts here. These are the general diseases and other things, but from here it starts, overweight. Fine. So now let us write here. Overweight, obesity, 29.5, resulting in what? Sedentary lifestyle. Come on, you write one sentence with this. Write one sentence. Come on, fast. Write one sentence. All of you. So overweight, obesity, okay, body mass index, BMI, BMI, 29.5. So which is causing which? Which is the cause and which is the result? You tell me. That you have to write there. Cause and effect you have to show there. The entire letters will be different on cause and effect. One concept or the other concept. I'll teach you all these concepts. If you understand this writing, you can easily discover reading problems and listening problems also. Reading and listening will be easy if you understand these concepts. If I teach you those concepts there, you will break your head. If you learn the concepts here, it is easy because everything is in front of you. Obesity is leading to sedentary lifestyle, or sedentary lifestyle is leading to obesity. Which is the cause and which is the effect? You have to think. You have to think. And then you have to write. Don't just write something because words are there to write. No, there is some relation. Which is leading to which? Come on, write the sentence. Sedentary lifestyle has lead to obesity. Okay. And 29.1 body mass index has been reported. Come on, write down sentences. Due to sedentary lifestyle, very good. There is a concept of due to. Underline that one and use that. Okay. Prabjit, lead past tense is led. When you use has, you have to use third form. Lead, led. So you are using simple present tense, first form. So that is wrong. Has lead is wrong. Has led, L-E-D. And body mass index, 29.5 body mass index. You said reported. You said reported body mass index. What is that? Okay. Prabjit Kaur. Body mass index, 29.1 body mass index has been reported. Who reported? Who will report? You are the nurse. You are the nurse. What all he tells you will not take it. So has been. Okay. So noticed or noted. Okay. So you'll measure. Okay. So you have to say body mass index. Okay. Has been noted. Reported is also correct. It's not wrong. So try to improve if possible. Meaning is correct. Sentence is correct. Grammatical is correct. But logical wise, I am telling you. Then next one. Jyoti Sridhar. Due to sedentary lifestyle, his weight is excess. Okay. Due to sedentary lifestyle, owing to sedentary lifestyle, because of sedentary lifestyle, write down. Due to, owing to, because of, on account of, write down, somebody write down and afterwards post it in the group, please. Due to, I'm giving you the connectors, I'm giving you the linkers, markers, conjunctions, everything. Whenever there's a chance, I'll come. One word is there and I'll give you 10 words. So due to, owing to, because of, on account of. Sedentary lifestyle was reported. or sedentary lifestyle resulted due to, no, try to understand this one. Sedentary lifestyle resulted in obesity and 29.5 BMI was recorded, not reported, recorded in the books, in the papers, in the application form. When he comes, what is your weight? They measure and they'll record it. You can use recorded is the perfect word. You have found, measure and record it in the books, in the form, in his file, in the computer. You record it. You measure and record it. So recorded is the right word, Prabjeet. Okay. 200% correct word. Sentence is correct, but the word is not appropriate. Somebody reported to you and you listened and you left, no. There's a purpose for everything. So recorded is the best possible word. Due to sedentary lifestyle, comma, Jyotish Sridhar, his weight is overweight, or his weight is more than his weight, you can say normal, is normal, not normal according to his age. Okay. Something you have to think. Just writing will not help you. Think. Sumaira, she has a sedentary lifestyle. Lifestyle is one word, comma, which has led her to overweight. Okay, which resulted or which has led her to overweight, to be overweight, which led to obesity with body mass index of 21.5. Fine. Different styles. Okay, all these sentences take, and if you feel that it's a mistake, you correct, you will become the best. Due to her sedentary lifestyle, she has increased body weight, very good, and reached body mass index 29.9. Okay, he is obese. Manikanta, this is Miss Helen Martin, and you are writing he. What do you mean? You changed the gender of the person. Miss became Mr. now. Hello, Mani.
Sir.
Enna Mani? Enna Panra? What are you doing? Huh? You understand? Whatever you are doing, you should be 100% within the subject. You know that we are talking about Miss Helen. Okay? And you should not go out of that. So she is obese. That's it. Okay?
Okay, sir.
I can correct you, no? Fine. Next one, Sumaira. Very good. Thank you. Due to, because of, on account of. Next, Smita. Sedentary lifestyles were the cause of his increased. One person will have only one lifestyle. Okay? One life. So one lifestyle. Think like that. So lifestyles, how many sedentary lifestyles he has? 3 or 4? I don't know. So I should ask Smita Kanta. Okay. If anybody has doubt, ask Smita. Next one, I'm joking. Okay. Was the cause of his increased body weight and a body mass index of 29.5 was recorded. Okay. Due to sedentary lifestyle, obesity. Because of sedentary lifestyle, her body is over the normal limits, and body mass index has been noticed 29.5. Noticed. It's okay. Sentence wise, grammatical wise, it's okay. But there is something called logicality. Logicality. Vocabulary. Grammar is okay, but vocabulary mistake. Okay, next one. She has a sedentary lifestyle, comma, which has led her to be overweight. With a body mass index of 29.5. Okay. Smita, sorry, I also did his. Okay. Due to poor sedentary lifestyle. Okay, very good. So this is one sentence. Very good. Now, second point. Second point. Okay. Second point is this one, explanation. You are giving an example to what is sedentary life, his lifestyle. You are giving an example to his sedentary lifestyle. How can you say that his lifestyle is sedentary? Okay. What you are giving support, proof. This is called evidence. Statement and evidence. Write down. Statement and evidence. You say something and you will give the reason. You say something and you will give this. He is mad. He is mad. He fights with his own shadow. That is what it is. You give a statement and you give a valid proof to support your statement. That is what it is. Statement and supporting statement. This is the point. Statement and supporting statement. You tell something. I failed in the examination. Why? Simon Peter did not teach properly. Simon sir did not teach me properly. Yes. This is the proof for telling why she failed. That is very clear. Absolutely clear. Okay. I am not able to attend the classes. I am not able to attend the classes. Simon sir speaks during sleeping time. Simon sir starts the classes after I sleep. So how can I attend the classes? So that is the reason. Okay, solid proof why something is happening. Why is he overweight? Is means sedentary. Why is he sedentary? Because he does nothing. He does nothing, or he does not do anything. He does nothing. He does nothing. He does not do anything. See, playing with words. Playing with words. Okay. Now link this one to that one. Come on. Link this one to that one and give your own experience. You need not write all these things. You write your own sentence. He does not participate in simple activities, even simple activities. For instance, groceries, he will not go and bring. Okay, he will not go to the market to bring the groceries. Reverse of this, because he orders groceries, that means he doesn't go to the market to buy groceries. They are very essential things. He doesn't go. He has to walk his dog, but neighbor is walking his dog. That means he cannot walk his dog also. So, lazy. Okay, laziness or lack of interest to do anything, whatever it is. You have to think. Come on, give some supporting statement to this. So one sentence you write here, giving supporting sentence. Sedentary lifestyle, why? Give that example there. whenever any measurements are there, you use the word recorded. Or noted, or recorded, or registered. Write down the 3 words. Recorded, noted, registered. These are the words. Recorded, noted, registered. These are the 3 words you can use for measurements. Measurements. Okay. What are the reasons? Why? How can you say that this is sedentary lifestyle? I will, after you write, I will show you how to build this sentence. I am giving you 1 minute. Due to lack of interest in daily life, she has a sedentary life, which has led her to be obese, and a body mass index of 29.5 was recorded. Very good. Even the neighbors walked her log. Yes, come on. Come on, come on. Yeah, those who have work can leave, no problem. Work is more important. Yes. Come on, write down at least 2 more sentences so that I can give you some more points. So here, the point is, he doesn't drive, number 1. Number 2, he doesn't cook. Number 2, he doesn't travel, he doesn't cook, he gets everything to him, okay? And he orders frozen meals, okay? So inactive lifestyle, okay? Sedentary lifestyle, these are some examples, okay? And next, he doesn't go and meet his family also. Contact with family, intermittent, rarely, intermittent, rarely. So don't use negative words like laziness, okay? It is not good to, it will be like, judgmental. Laziness, drinker, smoker, these words will be negative words. So avoid those words. Right. Okay. So that is the point. Second point. Right. Now the points here is no longer drives. She, next one is doesn't go to the market, doesn't even walk her dog. So this means that she will not leave her home. She will not leave her home and she will not move out of the house. For everything, she depends on others. To bring groceries, she calls on the phone and they will be delivered at home. And for walking the dog, she calls the neighbor. Neighbor will take the dog out. So try to understand this. So this means that it doesn't mean that she is calling them, or it doesn't mean that she is calling the neighbor to walk the dog, but this indirectly means that she doesn't want to go out of the house, even to walk the dog. So that means it's very clear that she is not interested to leave home, never leaves home. This is, you can say, does not step out of the house. She does not step out of the house, not even to walk the dog. Okay, doesn't go out of the house only. So leave alone taking the dog out. She doesn't step out of the house. This is one point. That is the meaning. You have to understand what he is telling there. Next one is, okay. Next point. Contact with family intermittent. Contact with family intermittent. Okay. Contact with family intermittent. So that's why arrange regular family visits to monitor progress. Try to understand this one. Family visits are required, that's why. Nobody is visiting him, her, or she is not visiting anybody. So that is it. Contact with family intermittent. What do you mean by contact with family? Contact means interaction, social interaction. Family interaction is only not there. What about social interaction? Nothing. Okay. So interaction with family. That is the meaning. It's a big no. Intermittently, it's all off, on and off. Maybe weekly once or monthly once or like that. So if family is only no, then what will be the society? So social interaction also will be less. Try to understand this one. She has no relation with the family only properly. Then what relationship will she have with the society? So she doesn't do family activities only, no. So she will not go and involve in other activities. So that is what it is. So social interaction, family interaction, personal interaction with others. Okay. That is 0. Fine. Next one, number 4. What else you can see? And this is her situation. This is her situation. Because everything she is doing all alone. Okay. They are in Greater Greenville area, living close only, not very far. And all the siblings, 3 siblings are also unwell. Okay. 3 siblings are unwell. Okay, fine. They live close. Even then, she doesn't go there, nor they come here. So that's why they are unwell. That means they also cannot come here. She is unwell, so she also cannot go there. Hindering the interaction. Okay. Next. So she is living alone. She is living alone. Lives in own house in Greenville. Okay. And nobody is there with her because she is never married and she has no children, and siblings will not come to her because they are sick and unwell. Okay. And these all 5 nieces, siblings and 5 nieces and nephews living in greater area. Okay. All they live Greater Greenville area, but they will not come here. So she is alone. So that means you can understand that she is independent. She doesn't have any association, lacking association with others. Lacking association or meetings with others. That means this is others. That means this is isolation or separation. Separation, isolation, or you can say loneliness. Loneliness, words I am giving you. Loneliness or deserted. Deserted means everyone left. Okay. So they all left her, she left everyone like that. Separation, isolation, loneliness, deserted. All these are synonyms. You can use any of those synonyms. Then next one. So because of all these things, this will happen. This is the result. Okay. No interaction, so lacking association with others. That is the cause and this is the effect. Then next. Now what else is there which we did not tell earlier? Financially independent, okay. Coronary artery disease already told, angioplasty already told. Okay. Okay, angioplasty already told. We already discussed about this. So what is left? Celiac disease is left. Okay, this is important now. Celiac disease is important now. So you have to mention this one. Okay, either in this paragraph or you can tell with other things later. You can mention this one here because from here comes angioplasty. So this is the problem solution. Angioplasty is the solution for the problem angina. So from here, actual story is starting for the hospital. This is the point. This is the separation. You can see there. So angioplasty. From there, that's the reason why she went to the hospital. Okay. Now you see coronary artery disease and all the other things and overweight, sedentary, heavenly life, everything is there. Fine. So this celiac disease, you can add in this one or you can add in the next part as a minor one. Okay. And what is that? You can write there. She has a celiac disease. What is this celiac disease? Okay. Celiac disease means a medical condition. So she has a medical condition, correct? She has a celiac disease. Okay. She has, okay, celiac disease. A medical condition in which, okay, the intestine reacts badly to a type of protein contained in gluten, a substance found in some grains. That is celiac disease. So that's why if she has celiac disease, she should have gluten-free diet because every time she takes in gluten, okay? So you have to know this knowledge. It's okay if you don't write this one, no problem. But this is medical knowledge. That is different thing. Okay. So for this purpose, they have to not give this one. Fine. Next. So these are the points you can write. Either you can add this one, I'm putting in bracket. Okay, spelling. COELIAC. Disease. I'm placing in bracket. Okay. This is choice. You can write here or you can write later. That's important. Okay, now you make one paragraph using these things. So these are the points. You can make some sentences. Prabjit covered because of poor interest in daily living activities and inadequate social interaction, okay, has led to sedentary lifestyle. So because of, you need not write if you say has led, okay. Sedentary lifestyle, a major cause of obesity and body mass index. Very good. Thinking is improved. Your knowledge thinking is improved. Now, come on, write this paragraph. Okay, who are there now? Yogendra, Vignan, Suja, Sudha, Smita, Sitara, Prabjit, Manikanta, Jyotis, Jasmine, Greta, Ankita. Yes, very good. Now you can write your own sentence. Okay. Now, paragraph number 2. Okay, you can write that later. Now I'll tell you about paragraph number 2. Paragraph 2. Now in the paragraph 2, what you will write? I told you it is during hospitalization. Okay. During hospitalization, what we did? Okay, now let us see. During hospitalization, routine post-operative recovery. Okay. Routine post-operative recovery. Why should we tell her this one? Is it needed? Is it necessary? Not necessary. Because recovered, how she recovered, what she did, what we gave, all these things, are they important? Hospitalization, are they important? No. Okay, tolerating light diet and foods. She's able to tolerate light diet and foods. Is that necessary now? So during hospitalization, this is happening. She's able to tolerate. Now only she is able to tolerate. So after discharge, she can be perfectly able to tolerate. Okay, improve only. She can. Now only she is able to tolerate. Then next in future, she is perfect. Next, bruising at catheter insertion site. Little bruising is there. That is normal in many cases. Then no signs of infection. Good. Bruising at catheter's insertion site. This is very normal. So what is special in that one to write here? It's a common phenomenon. The insertion site. No signs of infection. If there is no signs of infection, why should we tell? Then bleeding noted post-procedure. Okay. No signs of infection, no signs of bleeding. Noted post-procedure, everything is fine. So why should we write this one? Okay, what is the need for this to be written? Patient anxious about return home. Patient anxious about return home. Is it required? Is it necessary? She's anxious, this is her feeling, that's all. Then, not sure whether she will cope. Not sure whether she will cope. Not sure, unsure. Not sure means unsure. So is it important? Is this important? So if the information is important, then you're, but during medication, during hospitalization, what is continued? For which problems? What is continued for which problems? Earlier and now. From the past to the present, what is continuing? So now let us see there. So till here it stopped. So it is continuing here. You see. So there you have to write about. Okay. Now what are the medications that is given there? Okay, anxious about health problems. Anxious about health problems. Anxious, that is a feeling. Anxious about health, that is not true. She is anxious about health feeling. Tends to focus on health problems. Okay. Next one, coronary artery disease. Coronary artery disease. So what are the medications taken? Then what already treatment we have a solution. Then next one, hypertension you have. Hypertension. The worst one, I'll change the color. Hypertension. Okay, hypertension. Now, hypertension, for hypertension, you are using these medications, metoprolol and ramipril. But these are brand names in bracket. Those are generic names and these are brand names. Okay. Now, generic name is important or brand name is important. For example, if I tell you, you are a nurse, your name is Ramanpreet, or your name is Prabjit, or your name is Ramila, whatever it is. If I call you nurse, you will be happy. Or if I call your name Prabjit, you will be happy. You remember that. Which is better? Calling a person by the professional name or calling the person by personal name, which is more regarded. So, whenever two names are given, brand name, Prabjit, note down these points which I am telling you. Whenever you are giving both the names, what both the names? Okay. Generic name and brand name. Generic name is metoprolol and brand name is Betaloc. So that is very clear. This is the brand name. This is more important. This is more important. Yeah, Betaloc. So don't write metoprolol, write Betaloc. Why? It's a special name, not just a brand name. This is a type of brand name. This is not just a generic name, but it's along with generic name is common for everyone. There will be 3 or 4 brands. Generic name will be same, but brand name will be different. Every nurse has the name nurse, but every nurse has a special name of her own. So that is very special. So when you know that something is there, you concentrate on that. So here, Betaloc is the brand name and metoprolol is the generic name. Now let us study what the medical dictionary is telling. I'm teaching you concepts. Many students have gone, let them go. We don't have the problem. So the brand name. That is metoprolol, Betaloc. B-E-T-A-L-O-C. Betaloc. So when you type Betaloc, okay. Yes, Betaloc. Okay. Now what is this? Betaloc, capital letter, that is brand name. Metoprolol. So now see this. You can understand here. Betaloc, metoprolol. Small letter means that's it. Now here, Okay. Better luck. Sometimes they'll give in the bracket, sometimes they'll give outside. So accordingly to you have to reason which is right and which is wrong. So generic name, I'll show you here now. Okay. Now see here. This is it. Generic name is metoprolol tartrate. Product name, that means brand name, is Betaloc. Hope you understand what I'm telling you. So generic name should be small and brand name should be capital letter. I hope you understand what I'm telling you. Wherever it is, brand name should be capital letter. Generic name should be small letter. I am teaching you a new concept. So, generic name. Generic name. Okay. I am typing here. Okay, that is it. Now it is very clear for you. Generic name and product name. Generic name and product name. So you have to remember that. So capital letter and small letter you should understand. Now which is more important is that point. When I told you general to specific, general is not important, special is important. When something has a special name, why don't you use that special name with a capital letter? I don't know. I'm asking you one word question. Respond with yes or no. If it is clear. Common name is nurse. Special name is, okay. Who is this fellow? Prabjit Kaur, okay. Not typing here only. Type it and keep it and post it in the group and also save it so that put it in the Telegram, put it here, put it everywhere, wherever you want. This is very important topic. When both the names are given, general name and special name. Generic name means general name. Specific name means a special name. When you have two names, one is general name, means nurse, that means everyone is nurse in your hospital. Some 10 people are there helping you along with you. So they are all nurses. Now you have special name, abracadabra. Then what would you like to be called? Definitely not nurse. That's it. So when you know special name, then use special name. Many people don't know that. Nobody will tell you that. I'm here. I'm going to tell you one thing. That is what I told you. General to specific. If there is general, leave it and go to specific. I'm telling you, I'm going to teach you a lot of points like this. Long back, I told you general to specific. When something is special, why do you want ordinary? That's it. Your daughter is special to you. Your mother is special to you. Your brother, sister, friend, colleague special to you. So why do you give ordinary gift to your special friend? Give something special gift. That is it. So always when a brand name is given, use that brand name. Remember that. For example, augmentin duo-forte is given. So write augmentin duo-forte only. Don't write the generic name. Okay, you understood. People think why sir is teaching so long. And today also somebody told 3 or 4 people, why are you teaching so long? What I should do? Should I, because I took you money from you, should I please you? I am not a people pleaser. I am not a people pleaser. I will not make you happy. Work hard. Otherwise, this platform is not for you. You promise to work hard. You promise to listen to me. You promise to do what I say. Do it. Do it. Learn. Okay? There are some children. They're small children. There's a saying in our language. Guddochi pillanekrichindi annattu. That means the egg came out. Okay, the egg came out and it started teasing the chicken. Okay, so like that. So they don't know, but they start teaching the teacher how to teach. Okay, so that is not fine. The teacher wants to give you the best. Okay, this is the reason why I don't give my admissions to employed people. I don't give because they don't have time for study. They have their work, they have their families, they have their cooking job, they have their children, they have everything. Okay. And they want me to teach, but they won't give me time to teach. So that is why, give me time. Give me time. Fine. So, what is important you understood? This is a concept I told you. General, generic to specific. Generic to specific. Yes. Fine. Next. Why I took you to this online medical jargon place? Medical, virtual medical center. There I have taken and I have put it down here. Why? Why should I take so much pain for you? Just because teaching is my passion. I don't teach for money. I don't teach for you, or I don't teach for pleasing you, because I love teaching, I teach. Okay, those who are really love learning, they will be there. Those who love all other activities, they're already tired and they'll leave and go and sleep. That's it. There are some people who took leave. There are some people who resigned after studying with me, then they started. Those people, there is one English postgraduate teacher, actually. She's a professor. Okay, PhD candidate. When I was in Amritsar, she studied with me. She was working as a professor in a university. She studied with me. Okay, and she started her own institute for teaching English. So like that, she resigned there and she came to me. She studied 1 month full and now she started her own institute. Yes, of course, that is a fact. So like that, when you learn something, it is good for you. If you don't have time, no problem. This platform is not for you. This is for the loving children who stay like this much time and they learn. Because when you learn like this, you will get diamonds. On the surface, you will get only stones. If you go down little, you will get soft things. Still you dig, you will get some pearls or something like that. If you dig deeper, then you will get diamonds. Okay. The longer you stay, the deeper you will go into the topic. You have a chance that somebody is speaking and you are listening. Do you think I am mad? Yes, I am mad. I am madly in love with my profession and I want you to get the best. Fine, next. No need to write 100 letters. Write one letter after preparing for 100 hours. That letter will be a masterpiece. Masterpiece. Right. Next. So that is it. So write about that one. So these are the medications you can write about. So here you have, what are they? They are different things. First one is coronary artery disease. And you are using aspirin and clopidogrel. Aspirin and clopidogrel. Now when you are using these two medications, now you see, okay, these are two important things. Aspirin is given and clopidogrel are given. These are generic names. These are generic names. Now when generic name only is given, write the generic name. Because brand name is not given. And you know aspirin is generic name. You know that. And in brackets, brand name is not given. So forget, na. I did not tell you that you have to write only brand names. Did I tell you? No. When you don't know the name of Prabjit and she is in the uniform of a nurse, then you can call her nurse. Because when you don't know her name, Prabjit, then how can you call her Prabjit? So at least call her nurse, no. Don't say A, O. So try to understand what I am telling you. Because something is better than nothing. Instead of not writing the brand name, at least write the generic name, because generic name is there, instead of ignoring it, because it is important. So aspirin is important here. Aspirin is important here. And then clopidogrel is also important, but the more important one has come, that is Plavix with a capital letter. When you say capital letter is a king and not capital letter is a soldier. When the king comes, a soldier always bows his head. I'm not talking nonsense, I'm talking sense. Why capital letter? Because it is important. When important one has come, ignore the unimportant and give. When you are sitting, your boss comes, stand up. Only one chair is there. Stand up and give your seat to him. That is the level of importance. When the chief minister is in the house and the prime minister comes, chief minister, you are an ordinary staff. Chief minister has come to your house. When the chief minister comes to your house, you stand up and give your seat to the chief minister. But when the prime minister comes, only one chair is there. Even the chief minister gets up and asks the prime minister to come and be seated. Why? That is the importance. Give due importance because of the capital letter. Be careful. In the official letters, brand names will always be capital letter, whether it is in the beginning or in the middle or anywhere. But generic names, when they are in the beginning of the sentence, they will be in the capital letter. But in the middle of the sentence, they will not be in the capital letter. Beginning in the sentence, it will be capital letter because it is the beginning of the sentence. By default, it is capital letter, not because of its standard. Remember that. So whenever a word, a medication is in the name of the name of the drug is there, if it is in the beginning, then there is a confusion. Be careful. Then you have to think more. But if it is in the middle, no confusion, because generic names will be small letters. Brand names will be capital letters. So, but if it is in the beginning of the sentence, be careful. You may face problem. So you have to think and decide. Next. So write aspirin and write Plavix. Aspirin and Plavix for coronary artery disease. Number 1. So this is medical information. Okay. Right. So that means these are ongoing medications, current medications. That she is on these medications now. She takes these medications. Write down, write down, write down. They're coming just as a flow. Write down. Ongoing medications, current medications. Currently she takes. Presently she is on. You alter the words, change the words, but no problem. Okay. Her current medications are ongoing medications. She is on, means currently. Currently she is on. Or currently she takes. That's it. These are the words which you can use here. Okay. So the current medications include, maybe she has some other medications also, but these are the medications which include. What are those? Yes. First one is first. Main is coronary artery disease. So first comes first. Okay. Her current medications include. The present medications are currently she is on, currently she takes, or presently she takes. As her current medications include, or presently she is on, or currently she takes. Aspirin, small letter, and Plavix. For what? For angina, for coronary artery disease. Try to understand that. So when you are telling this sentence, there is a logic. First, you set the stage. What is setting the stage? Time. Time is the stage. Currently, her current medications are. Presently, at present. This is called the, so you have to bring this forward. Her present medications are. Currently, she is on. These are the stages. Any one stage you take. Her current medications include, or her present medications are. Okay. Now next one. Aspirin and Plavix for, go back, coronary artery disease. Comma. Next one. Now next problem is hypertension. So you write there. There you have two generic names. and 2 brand names. So put a comma because you are separating those medications for that disease, these medications for this disease. So there are 2 different groups. So separate these groups by a comma. If there are only 2 groups, you put and in between. If there are 3 groups, you put comma for the first 2 and for the next 2. Now here you can see. Please don't write anything on the screen. Okay. Disable annotation for others. Okay. So, no problem. I know by mistake. I'm telling you, actually it was my mistake. I did not hide that one every time I do. It's okay, no problem. That's not a big crime. It's okay. Right. So, now you see here, this is point number 1. This is the main culprit. Next one is hypertension. That is the next one. And this is the third one. So you have 3 different problems here. So in between 1 and 2, when I are joining, you put comma. When you are putting 2 and 3, you put and. Those so simple as that one. Okay. Her current medications include colon, aspirin and Plavix for coronary artery disease. Semicolon. I'm teaching you the list, write down. How to make lists. I'm teaching you, write down. Okay. Her current medications include colon, 2 dots, one above the other, one down and one above. One below and the other above. Her current medications include, that means is to, that means colon, that means is equal to. Her current medications include all here. And these 3. Her current medications include means 3, means total. On the other side, is to means is equal to. This side, all is equal to 3. 1, 2, and 3. That is the list. How to make a list? Okay. There are some people, sir, we are nurses, sir, we studied for 15 years, sir. We went for exam 5 times, sir, 4 times, sir. There are some people who ask me, we know a lot about this, sir. Why are you teaching so much for us, sir? This concept. For this concept, that is a big 0. Already 5 times lost. And how can you say that I know too much? If you knew too much, you would have cleared at least in the 4th time or the 3rd time. How can you say I know too much? No, learn. Humility, being humble is a virtue. Being humble is a virtue. When anybody asks, okay, say yes. Okay. My students ask me many things. I say, okay, I will tell you. That's all. Maybe I'm a teacher. There's different thing. Maybe I'm double your age. Maybe my children are your age. There's a different story. Patience is a virtue. Okay. Learn. If you are not ready to learn, you have to go for the 2nd time. You have to go for the 3rd time. You have to go for the 4th time. You have to go for the 5th time afterwards. So I lost hope. Why? That patience is not there to learn. I'm telling you people, I will not dare to tell those people because they are not patient to listen that also. For a patient person, you need not tell him to be patient. He's automatically by default, he is patient. It's a virtue. It comes by practice. It comes by wisdom. It comes by knowledge. It comes by understanding. Not every Tom, Dick, and Harry can be patient. Because you are patient, I am teaching you. If there is one person who is patient, I'll be there teaching him. Let all the others go. That is not my problem. Yes, I need people who are ready to listen to me. So listen these things. I'm showing you point by point there. 1, see there, is 2. That means the left side is equal to the right side. The left side is one group. The current medications all together. That's the meaning. Include means there are more, but these are included. Number 1, there's a first one, first one in the list. Aspirin and Plavix for coronary artery disease, semicolon, dot and a comma below, semicolon. Next, second of the list. Semicolon means plus. End means plus. Comma means plus. Do you know that? Okay. Metoprolol is the generic name. Betaloc is the brand name. So which one you choose? Choose Betaloc. Ramipril is generic name. Tritase is brand name. So choose brand name. Betaloc and Tritase. Yes. For hypertension. Okay. Or you can say also like this. These are phrases. You can also use clauses also in between. Aspirin and Plavix to treat. Okay. Coronary artery disease was managed by aspirin and Plavix. Hypertension was treated with Betaloc and Tritase, different type of style. Then you have to change that side. The course of action includes. You have to change. Both should be equal. That side style, this side style should match. Medications include means you have to start with medications. Course of action includes means you have to start with the disease. You can with that side or this side. A dancer who knows how to dance dances properly. But a dancer who does not know how to dance blames the floor. See, the floor is not nice. I cannot dance. That's it. The floor is slippery. The floor is rough. The floor is because she doesn't know how to dance. No, she wants to escape. That's all. If she starts dancing, people will know that. Yes, escapes. Some people say, no, reading nobody can teach you. You have to read on your own. Why? A dancer who does not know how to dance blames the floor. This is a worldly saying. I'm not telling. So That is what I'm. If you do not know, oh, it is very difficult. Why difficult? You learn. Be patient enough to learn. Semicolon, last one. And the last one. Ator was starting for hypercholesterolemia. Right. So now you can write this sentence. Come on. This is very important sentence. You write however you want. Write with commas, write with colon and semicolons, or however you want. You can write. So that is very, very important. So this is regarding medications. That is very important. And then somebody is making sounds. Please switch off your mic. Then next, last one. Now this medication, these medications, or this, all these things. So plural medications. These medications, they should be continued. They should be continued. Jyoti. Okay. Right. These medications should be continued. Now let us see here anything regarding medications. Compliant or anything intermittent? No. Okay. Now anything regarding medications. Okay. Yes, this is it. So already you have spoken. So you link this one to that one. Already medications are spoken there itself. Because it's not only about future, because it is past, present, and future. The last paragraph is only for future. But this is for past, present. She took earlier, she's taking now, she will take afterwards also. That is the logic. So you can bring this sentence, this part, monitoring adherence to medication regime. This, because all medications you have already talked. Now, why do you want to take this in the last and tell there? Why do you want to break this link? So that sentence should continue with this one. So monitoring medication compliance is recommended, is suggested. Okay. Monitoring. Okay. Or continuation of these medications is to be monitored regularly. So this is the paragraph. So now, yes. Now next. So here, the point is, one question next. Respond. The paragraph is finished. So respond whether you understood or not. Because we have come to the last stage now. If he has given adherence there, then you have to write, yes, I'm giving you 5 seconds to 10 seconds. Just if you understood, write yes. If you did not understand, write no, so that I can ask you what you need an explanation for, and otherwise we will move forward. Come on, fast. So this paragraph is finished. It's in the last paragraph, and we are going to finish it. So 3 students have said. What about the others? So you are doubt whether you are understood or not. So benefit of doubt. So I have to ask you to clear. Okay. So right. If you don't have, if you have not understood, you can ask me, no problem. Maybe some students might have doubts. Okay. So this letter you can write tomorrow. Okay. Mistakes will be there still. Okay. You cannot become expert overnight. Practice, practice, and practice. Okay. And you may think, why, sir, you are teaching so many things to us. Now you can, there is 5 minutes, half an hour, you can teach and finish it off now, sir. I told you already, I am not teaching for you. No way. I am teaching for myself. I am teaching for myself. Because the more I teach, the more I get knowledge. The more experienced I become. Okay. Fine. Right. Next one. And I am happy for that. For that reason, I don't need 100 people. I close my eyes. I don't know who is there. Even if nobody is there, I can teach. There's not a problem. Okay. So, next, last paragraph. Last paragraph, you have to write about the other things. Yes, last, discharge plan. So, she is going to be discharged tomorrow. So, she wants to go home. You see here. Okay. Where is that? Yeah. What she said? Patient anxious to return home. Yes, here. During hospitalization, patient anxious to return home. Okay. During hospitalization, patient anxious about the return home. She is not anxious to return home. She is not anxious to return home, but she is anxious about to return home. What do you mean by the difference? Try to understand. Many people think that she wants to go home. No, she is upset to go home. She doesn't want to go home. She is being discharged, but she doesn't want to go home. Try to understand the difference. Patient is anxious to return home, means she wants to go home. Patient's anxious about return home, means she is worried to go to home. She does not want to go home. Why? And the reason is given there. The statement in the beginning, and everywhere the same rules are applying. And why don't you understand that? She is against going home because she is doubtful whether she can cope with her situation. Who will be there to take care of me? Can I manage all by myself? It is difficult, I feel. I doubt whether I can do all these things. From where you have to take? From there, not from here. That is the connection. Connection from there to here. She is worried. She doesn't want to go home. Because here, at the hospital, the nurses are there, the doctors are there, any situation, they are in safe hands. They trust you like anything. And there are some doctors and patients who treat patients like animals. I have literally seen. They trust doctors. They trust nurses. Doctor, tell me please. I am little worried, doctor. They're almost at the verge of crying. They're upset. And they come to you. Hey, sit there. Wait. The way how they talk to them. Okay. Respect them. They are your bread providers. They are your bread providers. Be careful. If they are not there, you are out of your job. You are out of your profession. Because the patients are coming, you have it 3 square meals. Your stomach is full. Why? Because of them. Gandhiji, Mahatma Gandhiji, the leader of the nation, said, customers are gods. Treat them with respect. Yes, they are your provider. Don't do that. Whatever your situation is, you are paid for that. Okay. The next one. Not sure, unsure, not confident. Write down the words. What are you looking for? I know you're just listening. So that's why I told you, what are you doing for? Come on, note down the points. Not sure. How to change these words? I'm telling you, no. Lacking confidence. Not confidence. Not confident. Unsure. Doubtful. Anxious, worried, upset, confused, not sure. Whether, if, will cope, will manage, will adjust. Will manage, will adjust, will adapt, ADAPT, not OPT, adapt. So these are the words which you can use in your letter. Don't use the same words. If you are using the same words, that means you are a copy master. They don't know the words what are there in the question paper. Do you think that you can fool them? Do you think that you can cheat them? Copy from here, paste here. Take the words there, write the words here. In between you put some additions and subtractions. Is that what is OET exam you think? Do you think why people are not getting marks? Do you know? Because they are copy masters. Some fellow asked me today on the YouTube, are you a genuine teacher? I don't know what he knows, what is genuinity. I'm least bothered about from that. Okay. I'm least bothered about that comment. Okay. Only those people who do not know what they can comment cheaply. Okay. If he really needed an answer, he would have called me directly and questioned me, asked me, sir. Okay. That means he wanted to destructive criticism. Destructive criticism. Okay. Not constructive criticism. If it is a constructive criticism, he would have asked me, what is your qualification, sir? In your question, you can understand what type of person a person is. So that means the approach will be different. So your approach must be different. Somehow clear the OET, copy paste. 50% of the words which they write are from the case notes. That is why they are getting 50% marks. 250. 60% of the words are from case notes. That is why they are getting 300. Okay. Sorry, for 40% or 35%. Only 10% of the words are there from the case notes, or 20% of the words are taken from the case notes because they cannot change. What is that? Angina, coronary artery disease. How can you change these words? You cannot change. So that is the only reason why those words are coming here. Otherwise, if they can change those words also, they will not bring those words. That means only 20. That is why they are getting 400 marks or 420 marks. The less the words you copy from the case notes. Sir, teach me writing. What I will teach you writing? Huh? You don't know that you should not write copy from the case notes? You don't know. Nobody told you. Neither you know, nor anybody told you. Then how will you realize that you are doing a big blunder? Variety is the spice of. How can you say that these 50% of the words are your words? Can you put your hand on your chest and say, these are my words? No, because you have copied from there and you know, your heart knows it. You can only say, I wrote the letter. But you cannot say, I mastered something. I used my own words. I did not copy from. You can say proudly, yes. That's it. I told you, when you dig deeper, you will get words. Powerful, powerful. Dynamites will come. That's why stay late. Because I'll go deep into the subject. If you are in the superficial level, you will not get this one. Okay. You go on, study. Then you will become masters in literature, masters in medicine, masters in nursing. After studying first class, second class, 10th class, plus 2. Then afterwards only you will become masters. And afterwards you become doctors in nursing, doctor in medicine, doctor in literature, doctor in zoology, last stage. Okay, that's it. Go deep into subject. Then only you will become master in that subject. You have to specialize in that subject. So specialize in vocabulary. You want vocabulary marks for vocabulary? You want marks for grammar? Go deep. You are just swimming on the surface in shallow waters. How can you be called as a swimmer? Yeah, you can be only just playing the fool there. You are not even a swimmer. How can you be a diver? D-I-V-E-R. One who dives deep into the subject is a diver. He is a proficient person. Okay. So be a diver. Stay till the end. You see in YouTube videos, they say, Last. Don't stay till the last. Something is there, twist. Like that. Okay. I also need last moment only. After going there, deep thought, then I can get, even I will get ideas and I'll get points. Okay. Next one is not sure, unsure. Okay, I already told this. The next one, whether means if. She will cope. Will, may, might, can, could. Use some other model. Don't use the same thing. She was doubtful if she could adapt herself to the homely environment, with the homely environment. Change everything. Concern, write down the sentence. A great sentence. Concern regarding adaptation to homely environment was raised. See the sentence. Concern means doubt, means not sure. Concern regarding whether. Adjustment will cope. Was possible. Will. Was raised. Concern regarding adjustment to homely environment was raised. That's it. Therefore, requested for an extension. That is the meaning there. Was reluctant for a discharge. Don't you understand there? Read between the lines. She was anxious to go home. Oh, what will happen? What will happen? How will I? That means she was not interested to go home. Okay. Reluctance to return home was noticed because of uncertainty regarding adjustment to homely environment. I tell another time, the same words will not come, something else comes. Okay. Doubts were raised. Finished. Another time, another words come. So you have to jugglery with words. Next one. So that is it. So like this one, from here you have to start. Now remaining things are there. Yes. Now let us see. Low calorie, high protein, low cholesterol, gluten-free diet. Gluten-free diet. So that is it. Because you know that I just told you what is the condition. Okay. Intestines react to gluten. So that's why gluten should not be there in the diet. Okay. So supervised by dietitian, referred by doctor. Is it important? It is not important. She doesn't need to know that. Who referred? Okay. Referred by doctor. Who supervised? Who referred? Okay. Try to understand that one. That is not important for her. So what you are supposed to do here? Providing low calorie, high protein, low cholesterol, gluten-free diet was advised, suggested, recommended, preferred. Okay, fine. Now here, supervised by dietitian, under the supervision of a dietitian. Okay. Referred by doctor. Don't think that you should need to write everything. Next one. Frequent small meals or snacks. Not 3 big meals. With a gap of 6 hours in between one and the other. Okay. Short gap and small amounts of food. Okay. The next one, drink plenty of fluids, abundance, consumption of fluids in abundance, consumption, fluid consumption, abundant fluid consumption. Okay. Excessive fluid intake. Fluid you cannot change. So don't change. Then afterwards, Simon sir told me to change every word. Instead of fluid, you write liquid, no? Don't spoil. Okay, don't go and. Somebody was telling, sir, you told that day something. That was a different situation. Okay. Right. Avoid putting hyphens while breaking words. Splitting words, not breaking words, splitting words. You split the words into 2 parts, no, not break the word. So splitting words into 2 parts, one right side and one left side. This above. Accommodation. So, I told if you don't know the rules, don't split the words. Leave the line, no problem. Come down and write. Or adjust there only, then write if you can. Don't split. Don't put hyphen and split, I told. And when you are splitting properly also, right side you split. When you turn to the left side, don't put a hyphen here, I told. That don't put a hyphen was in the mind. Then she said, sir, gluten-free. Why are you splitting, sir? You only told don't split. What is that and what is this? Where is the correlation for these 2 things? So that's why backdrop is very important. Learn the setting. Don't apply any rule anywhere. As it is. Okay. White color appeals in black background and black color appeals in white background. Appeals white color. So white color everywhere? No. Black color appeals. So black color everywhere? No. There is some relation. So be careful. When I say don't use the words as they are, in case you can change. That is the conditions apply. If there is a possibility of using a synonym, use it. Without changing the meaning and essence of the sentence. Then you use it. Otherwise, don't. Okay. Next, fluids. What other word you can use for fluids? Solid is solid. Fluid is fluid. Liquid is liquid. Gas is gas. What else you can use for these words? No. So use them. Coronary artery disease. Use it this as it is. So condition you learn. Okay. The face value is different. Next one. Consuming fluids in abundance. Consuming fluids in abundance. Excessive intake of fluids. Fluids will not change. All others would, this side will go, this side, this word will come, this side. You play anything here and there. Excessive intake of fluids. Okay. Fluid consumption in abundance. Abundant fluid consumption. But when you are changing the words, this side, that side, see whether the sentence is making appropriate meaning or not. If it is making the correct meaning and it makes sense into your mind, then use it. Okay. Learn the styles. Now the same thing. Consume fluids abundantly. Abundant consumption of fluids. Fluid consumption in abundance. Same words. Okay. But you have to modify the forms. Abundantly, abundance, abundant. Abundant consumption. Consuming abundantly. Okay. So, word forms. That is why what you do, write one sentence, leave it. Why don't you try other styles? When I asked you to write one sentence, you write one sentence. I gave you so much time. You could have written 3 or 4 styles, changing different forms. Okay. That is called you are your own hindrance. You are your own mind block. You want to write one sentence, you write one sentence. Why don't you experiment new varieties to enhance your quality? If you have 5, you can use one, any one. If you have only one and you lose it, you have none. Why don't you have 5? Practice. Sir, we don't have one only. Why you want 5, sir? You are mad. Okay, I am mad. No problem. Next one. Daily light exercises. Okay. Moderate. Regular, periodic, moderate exercises. Don't change exercises because it is the noun phrase. Noun you cannot change. Such as, e.g. means such as, write down. E.g. means for example. So for instance, such as, to name a few. For instance, for example, you can use instead of e.g. 15-minute walk, short duration. Walk. Short duration, walk. Exercise plan, monitored by physiotherapist. Okay. According to the physiotherapist's recommendations, that is plan, monitor. Plan means recommendation. Monitor means advice by the physiotherapist. according to the recommendations of the physiotherapist. Short duration walking, short duration walks. You can say, for instance, or recommended. No heavy lifting for 12 weeks. Refrain from, okay, strenuous labor involving physical strength. Why are you not expanding? Points are less, but you expand. That is your English. Refraining from engaging personally, okay, in activities by applying physical strength. Write whatever you want to write. Notes means what? Short notes. Take one short notes and try to expand it. Don't write too much. Again, too much is bad. Right. Next. Monitoring wound site for bruising or infection. Right. So make it a sentence. Periodic investigation for any signs and symptoms of infection or bruising is suggested. I am giving you A-grade sentences because you deserve them. The video is already recorded. It is on the YouTube. If you really love it, if you want to improve, go there, write down the notes, quality sentences which I have given you, and use them. Because all these things will come every letter. Not all these things come. At least some things will come. If you prepare hundreds and 10 letters like this, one from that, one from this one, all the 10 will go into your exam. Okay. Next. Right. With regard to dietary regimen, would be 4. Low calorie. So with regard to dietary regimen, because dietary is there, make it the main point. With regard to dietary regimen, comma, and continue with low calorie. Make a list of these 3 things. And next one, another sentence, physiotherapy. Based on the recommendations of the physiotherapist, physiotherapy is there. Bring this physiotherapist here. And continue. Put comma and continue. Regular, moderate, physical exercises. For instance, instead of example, short duration, 15 minutes. Walk, don't change. Don't say run. Don't say fly. That word as it is. You should have to be very wise to decide which word should go as it is, they are excused. They won't say no. You cannot help it. Or recommended, advised, suggested, preferred by the doctor. Or by the recommendations, they are already told, would be beneficial or extremely useful or extremely useful, would be better. Whatever you want to write, you write. 1001 different styles of writing. How many people are writing different styles? Okay, only grammar should be fine. Vocabulary should be fine. Next one. That I already told you, wood side for bruising and infection. As well as monitoring A, as well as B is suggested. Because you are saying as well as or along. Then you say monitor, single, so is only. Monitoring is, not all the other things in between. Monitoring is beneficial. So try to understand those points. Then it will be useful for you. Arrangement. Change the word. Regular family visits to monitor progress. Arrange regular means punctual, means periodic. Okay. Family visits, meetings, change. Monitor, observe, supervise, overview. Okay. Progress, enhancement, development, improvement. Okay. Would prove fruitful. Would prove fruitful. Would be excellent. Then requirements. That is what the patient, nurse should do. That is the responsibility of the nurse. Why I wrote BP1 here? This is BP3. Future is BP3, I was telling, but still I wrote BP1. Maybe copy paste something I did or what? Huh? 1 minute. This is discharge plan is BP3 only. Where are the other areas I told BP1? Important, I wrote lot of things are here. Important, future. Okay, these two are future, present. Okay, so Next one. Need home visits from community health district nurse, monitor adherence to post-operative medication, exercise, and dietary regimen. That is what we told above. Community nurse only, you are writing related to community nurse head or something. Nurse in charge or nurse head. Yeah, nurse in charge, you are writing. To monitor adherence to post-operative medication, medication compliance, exercise, dietary. Already we have talked. So this is not important now here. Already we have discussed. Next, regular monitoring by dietitian and physician. That's what it is. Here it is. Supervised by dietitian diet and physiotherapy supervised by physiotherapist. Expert professionals. Related expert medical professionals. Next. Danger of social isolation. Infrequent family support. This is the point in here. This is what I was searching for. Because family support is not there. Infrequent, intermittent, we told. Intermittent family visits. Here. Yeah. Intermittent, yeah. Contact with family intermittent. See here. This sentence we could have written in the first paragraph. Then I lost track that time. Family support. There's no family support. Intermittent contact. Off and on, when they want to come, they will come. That's all. They are not infrequent support, not frequent, not on a regular basis, not always. Rarely, that is what it is. Okay, that may be the reason. So maybe, probable, maybe, danger of social isolation. Loneliness, I told you last time. Loneliness. Staying alone. So that is, this point is the most important point. Though it is in the discharge plan. Because this is related to family. And family you have already talked there. And why do you want to write a new sentence here? This is a doubt. You have a doubt. Then don't ask her to doubt. Because you are telling her. Why do you tell what she has to do? This should not be written in the paragraph what she has to do. This is what you are thinking. Maybe, question mark. You yourself are not sure. So why will you tell her? So you tell in the beginning. Because of these things. Okay. Isolation. Loneliness. Right. These are the 12 diamonds. 12 people. And I am one, so 11 people. Let me see the names. Prabjit. Hello, Prabjit. Slipped off. Smita. Poor girl. What to do? Morning, 8 o'clock onwards, I'll start till night, 3 o'clock. My God. So people will not sleep or what? Hello, Smita. Okay, who is there? Raise your hand, anybody, if anybody is there. Yeah, Jyoti. I don't know who
Yes,
are. Yes, write the names of these students. Tomorrow we'll ask them whether they are slept or I'll
Okay,
write down the names of these 11 students. Okay, because they need special favors. And those who are awake, raise your hands. That means others are asleep, I feel. If you don't raise your hand, at least type a yes.
Yes, sir.
Otherwise, I feel that you are asleep. Write an S or raise your hand. Yes. Jyoti, write the names of these people. All the people.
Okay, sir.
And those who have raised their hands, you put a tick. Those who have written yes, put Y. And those who did not do anything, then put into. That means they are sleeping. Prabjit is really sleeping. Yeah. Sitara? Sitara said yes.
Hello,
Okay.
sir.
Okay. I'm really very happy. Okay, sometimes I sing lullabies to those people, who are already tired at work. They come and they want to learn. There are some people who literally told me, sir, you called my name. I came to know afterwards. I was watching YouTube. You called my name, sir. I'm sorry, sir. I slipped off because I was tired. Okay. Right. So I think I have given you quality according to the, okay. So finally, your feedback for the session. Don't just say you are teaching that, you are teaching good, you are amazing. Don't bring me. Write what you learned and what is the benefit of the session. Remove me from the topic. If anybody writes my name or butters me or say you explain, don't bring you. Otherwise, I'll shoot you with a camera. Come on. So feedback for the session finally. And before the feedback, I want to ask you to rate the lecture, not me, in the scale 0 to 10. And then afterwards, relaxedly you can type. If you already have typed, you can copy, select and copy, and afterwards you can paste whatever you have written based on that one. Don't just blindly give, think and give. I am giving you time. Okay. The other people will be typing or writing. Then one by one, I'll be talking. Okay. So, Jyoti Sridhar.
Yes, sir.
Yeah, can you share your experience?
Yes, sir. It was really an awesome session. I came to know many things, grammar and how to frame sentences and how to put in order past, present, and future. What you should give priority and how to use present perfect tense. What should be included? Everything I've learned today, sir.
Okay. Right. Thank you very much. So it was useful for you. So you understand that these sessions are very beneficial. So attend these sessions. And anyhow, live session is very good. You may watch on the YouTube, but even then, you cannot ask your doubts and clarity or anything you want. Okay. So this boy yesterday he was telling, I don't know anything, sir. Today he wrote so many things. Okay. Very good. Congratulations, Yogendra. You are very patient, sitting till 3 o'clock. Okay, next. Next one is Jasmine.
Yes, sir.
Yes, dear.
Yes, sir. Today I learned how to write the medication, the quality sentence, like different styles, sir.
Okay, good. So can you write this letter tomorrow?
Yes, sir. I will write and submit, sir, tomorrow.
Very good. Excellent. Yogendra.
Yes, sir.
Share your experience, dear.
Yes, sir. It's really amazing. Today, I learned a lot of things, sir. That like how to choose the relevant information from the case note and how to frame the sentence and lots of synonyms, sir. And how to use tense like grammar. So it's a really amazing session, sir.
Okay, thank you very much for your feedback. Amal Maria. Amal Maria, now your turn. Amal Maria. Okay. Right. She is not sleeping, she's there. Next, Manikanta. Manikanta. Prabjeet Kaur. Hello, Prabjeet. Where is she? Prabjeet? What happened? Why? I have kept it open. Prabjeet speaks normally. I may be tired. Okay. Next one. Sitara. Tara Sitara.
Hello, good morning, sir.
Good morning, dear.
So we learned today how to analyze a discharge letter and paragraph wise how to select the case notes and lot of grammatical sentences and lot of synonyms and lots of things learned today, sir.
Okay.
Thank you so much.
Welcome. Smita. 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 Okay. Poor girl, tired. Okay. Vignan. Vignana Jyoti. Okay, that's all for now. Okay, you can write your comment. And that is all for today. Right. Very good. Anybody is writing? Okay. If you have finished writing, okay, you can leave. Good night and bye-bye. All of you, good night and bye-bye. All of you can write this letter and submit tomorrow. Smita, you are there, but you're not opening the mic. What happened? Okay, no problem. Yes. So I'm counting till 10 and I'm closing the session. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Done. Good night.